Montgomery County.
Yeah. All right. Well, let's go ahead and get to Dr. Mayberry. I believe she's on the phone right now. She is our Tux doc. And are you there, Dr. Mayberry? Can you hear me?
Hi, good morning.
Good morning.
How's everybody doing?
Doing just fine. But you're curious as to, as the nation, is this...
Right.
This is clearly a precautionary measure here, but is it warranted?
Well, so I think because the guidelines, the messaging has kind of changed from if you've got gatherings of over 250 people, you should try to cancel. It's not necessarily warranted because of the cases that they already have, but I really do think it's out of an abundance of precaution. And so the messaging and the recommendations are fluid. They're changing constantly. Yesterday I was saying, okay, over 500, that's when you should think about not having an event. But, under that, if you're you're not around people who are, potentially in a population that is more likely to be affected, someone with immune deficiencies, the elderly, people who are on biologics, anyone who's had any kind of chemotherapy or radiation, people who have an immune hit. Those are the kind of people who really shouldn't be in these large spaces. But now they're just making it general public for everyone because it is a virus. And so they want to try to lower the number of cases overall. And so out of an abundance of caution, they're really,
well, it wouldn't
looking at a lot of events.
Sure. I mean, and this wouldn't be unprecedented as far as what the nation is doing as well, because there are plenty of other states who are shutting down any type of activity. I mean, even March Madness might be shut down.
Exactly.
So there's a lot of changes throughout the country in a variety of states shutting down any type of large gatherings. I mean, even talk shows and that sort of thing don't have an audience anymore. So it is out of an abundance of caution, as you say. But as a virus, we know that viruses can spread very rapidly. And because this is a virus, if anyone has contact there, then boom, it mushrooms, right?
Yeah, right. And very easily. Just think about how easily we get a cold virus. Right. The cold virus is a virus that has been around for centuries, and it just continues to mutate, and it's always there, and we always pass it along. But because we have the immune system that's built up to deal with it, we handle it fairly well. Because COVID-19 is so different from what people have been exposed to previously. It's new. We don't have the antibodies to deal with COVID-19. So some of the, antiviral medications are working for some people, but for others, it just isn't. So because it's so new, and there's so many people who could, have a severe reaction, and it's varying. People are saying, oh, it's just the elderly, but as you just reported, it's somebody in their 40s, and you don't know whether or not, how it's going to affect you depending upon your age. There really is no rhyme or reason at this point because we just don't know enough. And so, even I think Germany said that that they predict up to 70% of their population will be affected by COVID-19. I don't know how they come to that, but again, it's scaring everybody, and it's just everybody saying, you know what, instead of taking the chance, how about we just make sure people just don't gather in these spaces, because all you have to do is sneeze, breathe, cough, and there's a plume in the air that someone can walk into and inhale.
Then it spreads very quickly.
Very quickly.
And I know you've been on the air part of this week and last week and talking about the importance of washing your hands and hand sanitizer as well, but saying that soap and water is best. I will say that my family and I visited the rodeo the first week, and there were a lot of hand washing stations. There was hand sanitizer being handed out, hand wipes handed out as you walk throughout the area there at NRG Stadium. And we're taking live pictures, live looks here right now of the stadium and people there. But I suppose, as you mentioned, just out of an abundance of caution. We do know, by the way, that South by Southwest there in Austin was canceled.
Yeah. I mean, the thing is, you can wash your hands, but if you're breathing, if you're inhaling something that affects your respiratory system, that's the problem. You know, a lot of people are wearing masks thinking that's going to protect them, but it really doesn't. Honestly, the people who are the ones that are sneezing and coughing, they're the ones who need to have it on so that when they sneeze or cough, their droplets are caught in that mask, and then they need to throw it away and change it. But if if you're just out and people are coughing and sneezing, it happened to me the other day on the plane. I wiped the entire, plane down with Clorox wipes where I was sitting. But the people next to me and across from me, they were coughing and they were not covering their mouth. They were not coughing into the, bend of the elbow. And a lot of people still want to touch and hug, and they aren't spending enough time washing their hands. And I keep saying, please wash under those nail beds, because those nail beds are also, that's generally where you've got a lot of, dirt just accumulating, and people don't pay attention to that every time they wash. So, I mean, you do have to live your life. I personally was going to go to the rodeo this Friday.
Right,
so,
yeah.
Yeah,
right.
I mean, I wasn't staying away because of it.
Right.
But I get it. People have to make hard, difficult decisions.
Right.
The universities are shutting down, and kids are not having places to go. Some of them come from overseas. Some of them just can't afford to go home, and they're being kicked out of their dorms. So.
Yeah. You bring up a good point, Dr. Mayberry, so thank you so much. We sure appreciate speaking with you. But, that she was going to attend anyway. This, right. We can't live our lives in this fear and panic mode. But we have to be aware, and we have to be careful. And I think that's what she's really talking about there.
Right. I guess the question is, where's the balance, right?
Yeah. Right. Yeah.
Where's the balance? I guess the balance is, if you're not feeling well, then don't go out.
Then don't go out, right.
Those are the ones that sometimes they go out anyway.
Yeah. And you know what? We really need to be, and putting this into perspective, for the vast majority of Americans, I mean, this is not affecting them. For the hundreds of millions of Americans, and they may even get it, but it might be just a common cold, and it's going to pass. Because when you look at the statistics, not that, I mean, any death is severe, and it's sad, and it's tragic, and it's too bad.
Yeah.
But the mortality rate here, of course, we're looking at is around 3%, which is considerably low, but it's still a concern.
It is still a concern.
It is. It's low, but it's in a way it's also high. The reason I think that this is also an issue is because even though you think about some of the other global pandemics, you think about H1N1, the rate that COVID is actually spreading and actually taking lives is much faster. So this may not be as strong a virus, but because it is moving so quickly, that is where the problem is.
Yeah.
So, again, I think a lot of people hopefully will be able to survive it once they're exposed. But, again, I think right now they just want to minimize exposure as much as possible because it is moving quickly.
Yeah.
And Dr. Mayberry, if you don't mind, if you can, will you hang on for us just a few minutes? We want to let viewers know, because we are hearing from you on Facebook, we are hearing from you on Instagram and on Twitter, and you want to know, what about ticket refunds? What about the concerts I was supposed to visit? We are trying to get those answers for you right now. In fact, our newsroom is really working overtime to get these answers. I mean, we were just stunned to hear this. I mean, this is the first time we've ever heard something like this. The Houston Livestock Show and Rodeo shut down with so many concerts to go. And we do know that this is because of the coronavirus concerns. If you are just joining us here on ABC13.com or on our ABC13 News app, we do welcome you and thank you for joining us. You should know that the Rodeo Houston is expected to be shut down. We are expecting a news conference from our mayor here, the mayor of Houston, Mayor Sylvester Turner, as well as the county judge, Lena Hidalgo, to discuss exactly what is in the plans now. Art, you mentioned, well, will it be a shutdown just for this week or for next week? We are trying to actually figure out exactly what this means. Does this mean the rest of the rodeo will be shut down? Because we still have, I believe, 11 more concerts to go, at least that.
Tonight is Connie Brown, and then Cody Johnson tomorrow. Most certainly, I think I'm presuming that they're going to allow activities to continue throughout today, and then have everything shut down tomorrow. But we don't know that. We're just sort of speculating, and we're not sure of that at this point. So once we hear the news conference, then we'll understand a little bit more. But tonight is supposed to be Connie Brown, right?
Kane Brown,
excuse me. Kane Brown.
I'm sorry, our producer is talking to us too. And we should mention, we are just hearing from our producer that the World Health Organization just declared this a pandemic. So we're getting a lot of breaking news here. I mean, it's as it is happening right now. And we hope that you were paying attention to this. ABC13.com.
We don't want to, perhaps,
Sure.
you know what, I don't want to send any fear to everyone,
Of course
because,
not.
you know what, we've always talked about this being a pandemic. It's always been a pandemic. A pandemic is simply a disease or a virus that is spread to many countries. So, and the World Health Organization, in fact, weeks ago said this is a pandemic, but a minor one. But for them to officially declare it, it doesn't change a single thing. So that's what we want to make sure we're understanding here among the public. And there's no reason to panic or fear about this. But just be aware of what's out there.
And Dr. Mayberry, that's something you're kind of talking about too. Just make sure you're aware. Make sure you're washing your hands. This is not to cause panic, but certainly you do want people to be aware of what's going on. And that is something that's happening today. The World Health Organization declaring this a pandemic and making it official. So, Dr. Mayberry, are you still with us?
I think she left for a minute. You know what, let's get to Bree Berry. She's talking about the economic impact. She's been looking at the numbers of all of this. It's clear the economic impact of this is profound for the city of Houston. Not only that, but you're talking about tens of millions of dollars which are donated to charities throughout the Houston area, and especially those young people who work so hard, you know, to show their animals. And now much of that is going to be gone because 11 days of the show are going to be gone.
Right. So what I have here, and as you have been expressing, this just came down. We were getting all this information, so we're trying to collect all of it as quickly as we can. But what I have is a study that we have from 2019. It is just an entire economic impact study that's been put together. And so looking at some of these numbers, Art, you just mentioned it. You said how much money goes into this, not only directly, but also just the economy in general. So a direct impact from this study in 2019 was that it was $133 million. That's directly to the rodeo, which means it's what people are spending at the rodeo, people who have come into town, and what the money that they're buying from food and merchandise, stuff like that. But it's an economic impact in the greater Houston area of $227 million. And that was just last year. And we know that this year our numbers have been really great for turnout, both from the greater Houston area, people coming from all across Texas, and also there is an international presence there, as well as from other states around the country. So $227 million, when you think about that, that's just for, it looks like, predominantly lodging, food and beverage, shopping and merchandise, and that is even outside of the rodeo. So that's what people they might come into town for the rodeo, but then stay at a hotel, spend money at a restaurant locally. So it's not just the rodeo itself, but we're looking at all of these businesses that will be impacted, businesses who take time to get extra merchandise to be able to sell cowboy hats or, a decor, something from Houston. So we're talking about that number. And Samika, you mentioned it, scholarships. That's going to be a big one. So that's actually outlined in this right here, and I'm going to find that. So the rodeo had committed, this is just last year, so the numbers could be slightly different for this year, but a little under $500 million to the youth of Texas through more than 19,000 scholarships in 2019. So we're talking about millions of dollars from the rodeo going to these young kids. It was to provide these scholarships, grants, various awards that all comes from the rodeo. So it's not just our tickets we're looking at. It's not just the food that might have been purchased, but it is a greater impact here. We're also looking at, I'll give you an example of the calf scramble, right? We all love that. We watch each morning as we recap that. So for these contests from this study I'm looking at right now, winners took home more than $840,000 to use towards the purchase of a registered beef, heifer, or steer to exhibit in the rodeo for this year. So that money would have only been put back into the rodeo for 2021. So this is not only going to impact, obviously, the rodeo and what we're dealing with right now, but we're looking already ahead to 2021. That rodeo will be impacted because the money that is earned from a lot of these contestants, for people who are participating, they're not able to then return that money for next year.
Right. Yeah.
So we're looking at a greater picture here, but it's really upsetting, when you think about just the impact and the money we're losing. And, the rodeo provides, on average, a little over 5,000 jobs.
Right. I mean, no doubt, this is a huge economic impact here and a big hit here for the city of Houston.
Right. It is. I mean, and what it has as well is a ripple effect, because
sure.
you're not just talking about the impact which it has right here in the Houston surrounding area, but you know what? If you ever, I don't know if you've ever walked through those exhibition halls, but there are hundreds of vendors, and they come from all throughout Texas. They
absolutely.
come from throughout Louisiana, Oklahoma, surrounding states. They come here to sell their wares, and all of them are affected. They go home with no money, and they have to make the travel and the trip, and they go home
and
not able to spend that money.
And already been purchased.
Sure.
They've already made those plans.
And we want to certainly give the full picture here. We have so many people affected on both sides. And then you have those who are legitimately concerned. There were those who we heard from on Facebook and on Twitter and on our social media who said, well, listen, this year, because I'm just not sure, I stayed home. So that there are those who were concerned about the coronavirus, who had questions. So because of that, they didn't go. But we do know that it is expected to shut down today. We don't have a lot of answers right now. I will tell you that people almost immediately, when I posted it, they said, well, what about my tickets? What about my refund? We're working to get that information for you, and we understand.
No doubt you'll get your refund. Yeah, I'm sure that there, a plan will be made, and you'll be able to get your refund. I couldn't imagine them not giving refunds. So, I mean, and any other concert venue, when things are canceled, you get your refund. So,
but like you said, so many people were already hesitant to come out. So I imagine, and we haven't seen numbers obviously because the studies have to be done post rodeo, that the numbers are already down this year. The revenue, I'm sure, was already down from people willing to travel this far to be at the rodeo. So
some just held back.
Right, and so it's got to make you wonder now that once we find out more information about this, how this is going to affect next year, or businesses now with those numbers already low, dropping even further.
Yeah.
This, by the way, is the first time in some 80 years, and producers back there, please check that number, but I believe this is correct, the first time in 80 years that the rodeo has ever been shut down.
Yeah,
I mean, it has a running that's incredible. I mean, you're talking about well over 1 million people who are participating throughout that 3-week period, and it's just an incredible event. And it's just a real iconic type month for Houston.
It is. And we are, look at the pictures here, the sanitizer stations. I mean, as I mentioned, we visited the rodeo this year, and there were certainly extra sanitizers, stations on hand. They were handing out sanitizer, they were handing out wipes, and you could get multiple wipes. There were actually stations for hand washing. I mean, I'm sorry. Oh, we have our Nick Notario there at the rodeo right now. Actually, was working on a story. And Nick, we have you on the phone here. Do you know if people know about this yet on the ground? People visiting.
So we just got here. I'm actually on a golf cart moving around, and it's business as usual.
Yeah.
People here would have no idea what has happened. They're eating. I'm looking at the tables. They're eating their deep fried food, their good food, and some people charging for parking, paying to park as they come in. So I did see some HPD officers were looking down at their phone, and all of a sudden, groups assembled around them. Word is starting to trickle out about what has happened. But I would say overall, the majority of people here are aware about what's going on.
Yeah. Now, Nick, when you say the word is beginning to trickle out, are they thinking, well, does that mean I have to go home, or does that mean I can stay and we'll go ahead and continue the production of the rodeo throughout the day, and then possibly tomorrow then it will be shut down? What are their thoughts?
I don't know. I just saw like on HPD they were all looking at their devices.
Yeah.
And we were rushing to get on the ground, so I didn't get a chance to go over and talk with them. But I think people had a feeling this might happen, and if you look at attendance numbers, I did a story looking at attendance, that it was the slowest start in at least the past 5 years.
Sure.
Even with the the increased hand washing stations and everything, you could see the numbers were dwindling, and you had to wonder if it was a direct result of what's going on. But
right.
I don't know. We just got here. I'm like racing to go talk to people.
Yeah.
So, but, you know, the majority of people, I would say, just looking out, we're right outside Energy Center by the carnival, and it's business as usual. You would have no idea that they're about to cancel the rodeo.
Well, I mean, I suppose that's expected because people, you know, don't know about it, but eventually they will. And they're probably going to be asking, well, am I still going to be able to go to the concert tonight? You know, I couldn't imagine them, you know, getting law enforcement in there and trying to clear out the whole area. I don't know. It would just seem simpler to just say, okay, you know, after today, then it would be. But we don't know.
Yeah, we'll hear from them.
Well, I will tell you, if you're heading to the rodeo at this moment, people are still coming in.
Okay.
So
yeah, they're still allowing
coming
people
in. They're still parking them. So we haven't seen anyone. We didn't see anyone being turned away as we were coming in.
Okay.
So
that's good to know.
When I say business as usual, it's right now. But that could change based on what happens at noon. But as of right now, everyone is still coming in.
Yeah.
I have to ask you, Nick, are you still seeing a lot of hand sanitizer out there? Hand sanitizer stations, people handing out hand sanitizer?
So it's all over.
Yeah.
And I've been here a couple days, and in fact, it was so striking because they actually even have employees holding the doors of NRG Center, so that way you don't have to open the door.
Yeah.
So, and it's you know, fascinating to watch employees at the bottom of the escalator with hand sanitizer wipe, standing there wiping the escalator clean. So you could see the precautions the rodeo has been taking since day one. But yeah, you can definitely see the hand sanitizer, hand washing all over the grounds here.
And Nick, I'm sure since you're just getting there, you know, and if the message isn't out to everybody yet, but I wonder, just driving past in the golf cart, I mean, can you even guess how many businesses are going to be affected, from any, you know, small merchandise stands to the food trucks that come out? I mean, I'm sure they're going to be shocked and probably pretty upset for anyone who has been cooking all day long, getting ready for the crowd.
Well, you know, they prepare all year for this, and you know, I've been in other cities and worked where state fairs happen, and for these businesses, it's a huge part of their income, and to lose 11 days, which is what they most likely are going to lose, is a huge deal.
Yeah.
Because I mean, they really rely on this. And think about, it's not just the businesses in here. How about those people that work for the ride, the employees at the stadium that they rely on this income for the year? You know, 11 days could be a significant hit for some of those households.
Well, Nick, we know you're out there trying to get some interviews, so we'll let you do that. But
yeah, you know what? Let me bring someone on while I'm on the phone. We're going to set up, but let me just get a total stranger. I'm just going to walk over and you'll get their live reaction here on camera.
And that's our Nick Notario out there at the rodeo talking to.
Yeah, he just arrived out there, and it's very sad. I mean, I'm saddened by all of this because it's, you know, the rodeo is a huge deal. We go to it every year. Dr. Mayberry go to it every year. Dr. Mayberry, you're there. You go to it as well every year. It's a big deal in town.
Absolutely.
But, you know, but when you're talking about that many people, tens of thousands of people gathering every night, you know, I guess it's the safe thing to do, right?
It totally is a safe thing to do.
Yeah.
And I wanted to, you know, kind of comment on the fact that WHO finally made it, the World Health Organization, made it official that it's a global pandemic. I mean, they had been on track to do that for some time, as you mentioned earlier. But, you know, what it does is it also triggers a lot of governments around the world to take it more seriously and to be able to do things that they probably weren't able to put in place because, you know, there are always some people saying, no, it's not actually a pandemic yet.
Right.
So that official statement really means something. I know there are a lot of people that even ask me questions and they're not taking it seriously at all. So, you know, it may help more people take it seriously, but really it is more so about being able to put resources in place to help people that are suffering, to do more to get test kits out there, to make sure that, you know, people are being monitored in places where they are not monitoring it. And the suspicion is also that, you know, in the places where you don't see COVID-19, it's really only because it just hasn't been detected and there aren't tests available in certain places. So, you know, we're fortunate when we detect cases in Houston that we have the ability to actually do that. So in a way, it's a good thing to know, you know, that we actually have cases. You know, you look at Washington State, you look at California, you look at New York, and, comparing that to Texas, I mean, we're doing great right now, and we're a very international city.
Yeah, we really are.
So, yeah.
Considering how international this city is, because everyone travels here. You're talking about the fourth largest city in America and the petroleum capital of the entire world. So international travel out of Houston is incredibly huge.
Exactly.
So we have, relatively small numbers.
Right. And it hurts our economy, but you're right, it is heartbreaking because there's nothing more H-Town as the Houston Livestock Show and Rodeo. I mean, we just love this Livestock Show and Rodeo. So it hurts. It's like a gut punch.
Yeah, it is.
My daughter looks forward to it. Everybody looks forward to Houston Livestock Show and Rodeo. Once you go, you fall in love, even if you're not if you're a transplant, once you go, you fall in love with it, and you look forward to it every year because it is just such a great event, and it helps so many people.
And Dr. Mayberry, hang with us, if you will, for a second. It is 11:56 now. We are 4 minutes away from a press conference with Harris County Judge Lena Hidalgo, as well as the Houston Mayor Sylvester Turner, as they are about, and we're looking live here at, there on the box there, on the screen there, that press conference will get underway in about 4 minutes or so. The announcement that the rodeo is expected to shut down. We're talking about the Houston Livestock Show and Rodeo. We haven't heard anything like this. This has not happened in the last 80 years of the Houston Livestock Show and Rodeo. And of course, this is all because of concerns for the coronavirus. We've had a new presumptive case in Montgomery County. A man in his 40s or so, they are saying, that tested positive. They are waiting for the official results of that test. But we have 13 or 14 cases.
The Montgomery County case, the next case that is there now would be 14. Yeah, a total of 14 cases
in all of the Houston area. That includes Montgomery County. So this is a big deal. We've talked about the economic impact. Kane Brown was supposed to perform tonight at the rodeo.
Cody Johnson tomorrow. Lizzo is coming on Friday. That's a big deal. You were probably going to be headed to that one.
I was not, but I'm hearing from a lot of people who were headed to the Lizzo concert. In fact, I heard from someone just this morning telling me on Facebook, I am so excited about the Lizzo concert. But now we're hearing from people who would like to know what is going to happen with the ticket I bought. Someone actually said here on Twitter, saying to me, Samika, I bought tickets to the carnival, and my kids and I were going to the carnival today. Our director, Brandon, said, I'm leaving here, earlier in the newscast, he said, I'm leaving here and we are going to the carnival. Well, we are waiting on this press conference happening in just a few minutes with the mayor and the county judge to discuss exactly what this will mean. Will everything shut down as of tonight? Will it be the end of the week? We don't know. But the Houston Livestock Show and Rodeo is expected to shut down. Just incredible. And also the economic impact. We talked to Bree Berry about that earlier.
Yeah, I mean, we've talked about the numbers. We're talking about, $400 to $500 million impact here. And that's just, there's a ripple effect that you can't measure. You simply can't measure. And not only does it affect here in Houston area, but of course it affects all of the surrounding Texas area, because this is the largest rodeo of any of its kind. That Dallas has its rodeo affair as well, but this is like incredibly large when you're talking about 3 weeks, every night bringing in tens of thousands of people, sometimes filling that stadium most of the time with 75,000 people. And not only that, you have the carnival, which you have thousands more attending, and then you have the vendors situation. And that you see you see NRG in the background there. That's the big round building, of course. The flat one there you see, those are the exhibition halls. That place is just absolutely massive. And that place is just filled with vendors. Hundreds and hundreds and hundreds of vendors. Because we've walked through them. It's one of my wife and it's one of our favorite things to do.
It is.
Because there's so many cool things there. So many cool things.
And you can't talk about the rodeo without talking about the food, Art.
Right. And the food is out there, and you just love the food, and everything's fried, and you leave weighing 10 pounds more, but who cares?
But it's wonderful.
it's just an awesome event, and so that's why it's sort of heartbreaking.
It is.
It really is.
It is. You have people who are heartbroken, certainly, over this, and then we have to consider that there are those who are concerned about the coronavirus. Dr. Mayberry, you were there still on the phone with us. The World Health Organization officially declared it a pandemic today.
Yes. And, again, that is important because, that is going to make it, it's going to help a lot of people because resources are going to be deployed to make sure that we are getting a really good and accurate handle, as accurate as possible, on where new cases are, breaking out areas. If you're looking, like, let's say, we've got a new case in Montgomery County. Let's say we get 2 or 3 cases in Montgomery County. That gives us an idea that, hey, maybe in that area we need to take more precautions. We're not seeing anything maybe in a Fort Bend County, but we are seeing something. I'm just, speaking hypothetically now, but
sure.
It really helps you to plan and say, okay, let's do more investigation. You've got to have that kind of declaration in place for people to authorize the experts that are on the ground to be able to, go there and say, okay, look, where are the places where this has come from? How do we isolate this? Where are the neighborhoods it's in? Where are the workplaces that that we're seeing these type of events occurring? So I think it's very important, and I also think it's just good from the standpoint of, in terms of making it official. There are a lot of people that are making jokes about it that aren't taking it seriously. You want people to be able to take it seriously.
Right.
Absolutely.
Again, not panic, but take it seriously. Right. It's not a joke because we do have people around the world dying. Thankfully, it's not hitting us as hard here in the Houston area. But, if I was in, the Washington area, there are a lot of people who know people, that have, passed away because of COVID-19.
Sure.
So we have to take it seriously. We have to make sure that, we're just taking precautions. We definitely, you talked about the carnival. I have my Clorox wipes in my purse. My daughter, she knows to wipe down the seats and the handles and everything before she sits down. There are a lot of surfaces that people cough and spit and touch,
Right.
and then if somebody else gets in it, she gets into those cars because she sees those great vehicles out there. She wants one day, and I'm like, who sat in there before you?
Dr. Mayberry, we're going to have you just pause for a moment here because we're going to be going on the air live. We're on digital right now. We're going to transfer over to actual live on air. So just hold off for a minute and we'll get back with you, okay? Thank you. All right, welcome back, everyone. We are breaking on air to bring you this breaking news, certainly serious throughout the Houston area. The Houston Livestock Show and Rodeo will be shut down for the remaining 11 days. We don't know the exact time of when it's going to be shut down, but that's the breaking news we bring to you this afternoon and along with a news conference.
Absolutely. Take a look to the left of your screen there. That is that press conference. We do expect to hear from Mayor Sylvester Turner as well as the Harris County Judge Lena Hidalgo, and you may see those reporters sitting there waiting for that press conference to begin. And as you mentioned, the rodeo. The Houston Livestock Show and Rodeo expected to shut down as of today. We are waiting to see exactly how this will work. We still have at least 12 or 13 more performers as of today, but we are waiting to see how this will all work. This, of course, is all in response to the COVID-19 coronavirus outbreak and how it is affecting not only globally and throughout this country, but also the Houston area as well.
Yeah, and we're bringing this to you just to give you some perspective on the importance of this and just how profound this is. This has not been done in 80 years. That's how long it has been since the Houston Rodeo has shut down. That is a long time. 8 decades this has been going on without any interruption whatsoever. Now suddenly, because of the coronavirus, it will be shut down. We do not know whether that's going to take place immediately, effective immediately, including canceling the concert tonight, or whether it will take place or begin tomorrow. But there are 11 days left in the rodeo, and there are a series of concerts, some of the favorites of Cody Johnson and Lizzo and Keith Urban, of course, and
the Staples. I mean,
right,
the list goes on.
The list goes on, and think of the numbers here that are involved. On most of these concerts, you'll have 75,000 people attending the concert. You have thousands more attending the carnival outside of the concert, and then you have thousands more who are attending the actual vendors' exhibition hall, with hundreds and hundreds of vendors there.
Not to mention, on any given Saturday or Sunday, when you're talking about the Houston Livestock Show and Rodeo, you're talking about an estimated 100,000 people.
Easily. Yeah,
so
easily 100,000 people.
Economic impact to the city of Houston.
Yeah, massive economic impact. And not only that, you're talking about hundreds of millions of dollars in scholarships, which are given out every single year from the Houston Livestock Show and Rodeo. It has an impact of nearly $600 million, and there is a ripple impact that we can't measure as well. And you're talking about vendors that come from all around Texas, all around Louisiana, Oklahoma. They come from as far away as Utah and Idaho and Denver, you know, and so many places. Because this is considered Houston Livestock Show and one of the largest rodeos and vendor areas in the entire country. And it's known for that. And so you have all of these vendors who are going to be headed home without money in their pockets.
Not to mention the young people who were here, the high school students, the middle school students, the elementary school students who were here to show their prized animal. We had the steer auction that was supposed to happen on Saturday, and then the art auction that was supposed to happen on Sunday. So this is a huge impact. We're talking scholarships there. So we're a huge impact to this area.
Yeah, and as an example, I mean, even the steer auction, those steers will go for $300,000.
Absolutely.
I mean, that's amazing. But it's all because it's for charity. I mean, it's for scholarships. And it's just a wonderful opportunity to help kids.
And we want to put this into perspective. The reason why the rodeo is expected to shut down is because of concerns for COVID-19, the coronavirus. I want to go to our own Nick Notario, who is there on the ground right now at the Livestock Show and Rodeo. And Nick, you were trying to talk to people to see if do they know about it yet?
No, they don't. In fact, I want to go over and just bring you a. I just want to bring you over. Are we okay?
Yes.
Okay.
Yeah, we can hear you.
Let's go over. Hey. Okay. All right. Let's just go over. Hold on, ma'am. I'm with Channel 13. They just announced they're closing the rodeo for the year.
Okay.
What's your reaction to hearing that?
Scary. I don't feel like they should. I mean, it's too many vendors here. They've spent a lot of money here. Let them make their money.
Did you have any idea before we just told you? Were you aware?
No. Yeah. So I've got to go.
Okay. Hey, folks, question for you. They just announced that they're closing the rodeo.
What? Oh, because of the coronavirus?
They're shutting it down.
Oh, that's terrible. This part of it too?
All of it, the entire rodeo.
Tell me I gotta go.
Well, we don't know exactly when they're going to do it, but what's your reaction hearing they're going to shut down the remainder 11 days of the rodeo?
I don't know. I think it's a little kind of ridiculous, reactionary, but I mean, at the same time, you know, you want to be cautious.
Can you believe it? You're here. Did you have any idea that that was going to happen today?
No, I mean, everything else, South by Southwest is getting shut down, and I thought we were the holdouts here, but I guess not, huh?
All right, thank you very much, sir. Appreciate it. Let's just go. I mean, I just want to show you how shocking it is for some people that are just trying to figure it out. Let me go over. Hey, ma'am, with Channel 13, they just announced that they're closing the rodeo.
Is it just the rodeo or the stock show too?
It's the entire. They're shutting the entire thing down.
We are stock show exhibitors, so this is beyond devastating to all of these kids. We spend time and money, tons of money coming up here each year. This is devastating. Like, we can't believe it.
What words go through your mind, feeling right now at this moment?
I'm kind of at a loss of words, other than this is quite ridiculous, because if you feel like you might get it, don't come to the stock show and rodeo. If you feel like you might be sick, don't come. If you feel like you might get it, don't come. Everybody else that works all year that wants to come should come and enjoy it.
See, your kid's crying. Can I ask her? So, why are you so emotional? Why are you're so upset? I can see it.
Because we spent so much time with these animals and thousands of dollars with these animals, and so to get the chance to win back our money next week with steers, that's devastating, because that means we're going to be in debt for a close it down.
That's one of the hardest things, right?
Yeah.
Because you raise your
It's hard. This is hard.
This is college money every year. They come, they show, they work for 12 months, they show, and this is their college money. This is how they get to college, by selling these animals that they worked with. So this, like I said, it's devastating. It is beyond devastating to everybody involved.
Thank you guys very much.
Nick.
So I'm the guitar. Yes, Art.
Oh,
yes.
You know, I just commenting on that poor girl's interview. I mean, that is the impact that this brings. I mean, we're talking about so many children like that who are saving and just working so hard to try and show their animals, and now it's all lost because that is their scholarship money.
And it's not only their scholarship. I mean, think about it. The rodeo, the concert makes hundreds of thousands, if not millions of dollars for scholarships for kids all across the state.
Yeah.
I mean, this is going to have a ripple effect, not just now, but throughout the year.
Absolutely.
I mean, the rodeo does a lot of great programs, you know, the FFA and everything else, all these kids, and it's just, you saw the emotion. I mean, she was standing there in tears because this means so much to these kids, you know? I mean, that's the impact. You're right, Art. I mean, that's it. It's just
so sad.
It breaks your heart to see it. It is.
And Nick, I'm not sure which photographer you're working with today, but as you were talking, your photographer panned off to what appeared to be a group of students who had masks on. Just wondering, are you getting the idea that if people decide to come or decided to come to the rodeo, they were taking those extra steps?
Yeah, when I was here a couple days ago, and you know, people, moms, dads, told me that they were bringing hand sanitizer. They were locating the washing areas here. I didn't notice a lot of people wearing masks around the exhibit hall, but I have to tell you, now there's just mass confusion when you talk to people, because like I think people are starting to get the notifications now. They know it's going to be closed, but people are wondering, are they going to have to leave the grounds? I can tell you, looking around, no one is being forced to leave.
Right.
It is business as usual. People are still coming in. They're in line to buy food. The rides are running. So I think people are just wondering. They're coming up to me asking, what's going to happen? Do I have to leave? I don't know. And actually, we went up to the media section. They have a team here, and I went up there and asked them that question, and they told me they know as much as we know. They're waiting for this news conference. They have no clue what's about to come. So a lot of confusion and a lot of heartbreak right now out here.
Nick, go ahead and talk with a few other folks there, because your interviews are so compelling. I mean, they're just so interesting to listen to.
All right, let's go. Let's see this gentleman right here. He's got the Astros in there. So they just announced that the rodeo is closed. This is it. Yeah. Did you hear that?
We just heard it. Yeah, we just heard it right now.
What's your reaction to hearing that?
I guess we're going home.
Have they told you got to leave or anything like that? Are you confused about what's going on?
Yeah, no, we just got here. We tried to get on some rides, and they didn't let us on, so I guess.
So the rides are not running?
Right. So we're just going to go home at this point.
Okay. So there you go. Thank you very much. You just heard the rides. Let's...
Tell them how sad things are.
Sir, we walked, they let us in, and then they just closed it. Like, we walked up there, and then it just closed.
While the babies were in line, and then they cut it off and made us walk away.
You're talking the rides?
The rides, all the carnival food here is open, but anything that's official rodeo is closed. We got a number for some sweet lady to maybe get our money back, but these babies didn't write a single thing. And my poor dad spent over $100 on tickets that we don't know if we're going to get back.
So you bought the tickets, got in line, and they said we're closed?
Yes. Face paint and food is all they got. All they got.
How are you feeling, Mom?
It's frustrating because they're disappointed and I can't do anything about it. It's their spring break and all I can do is say I'm sorry. I get it, but I wouldn't have them out here if I was scared of what they're scared of. You know what I mean? You know what I mean?
Does that frustrate you? That's angry?
It does. It frustrates me because I can't explain to my 3-year-old why I have to take her home. They're older and they get it, but when my 12-year-old says they're overreacting, mean, she's 12 and she gets it.
Has anyone told you that you need to leave, that the rest of the grounds are closing, anything like that?
We've had to walk up to everything to be told it's closed. Nobody's making us walk out. We're trying to get back into the exhibits, but they're not even sure we can do that.
Thank you very much, ma'am. All right, let's see if we can get a couple others over here. Okay, go ahead.
My kids in a very long line, and they just told them to move. Get out the way, and I bought all this tickets for nothing. I'm trying to see if I need my parking money back or my ticket money back. Like they said, we just got here.
There was no heads up, there was
No
nothing?
heads up, just told them to get out the line.
How are you feeling right now?
I just want my money back. That's all.
How much money did you end up spending on parking?
$80, parking $20, $80. Stand in a long line to get on the shuttle to get here. So it was they sad. My babies are very sad.
Is anyone communicating with you about anything?
Everybody I talk to, they say they don't know nothing. They having a press conference right now. They don't know nothing. So they not telling nobody nothing.
How do you feel?
I'm very sad. I'm upset. I lost a lot of money and didn't get to enjoy myself because they look forward to this on their spring break. And I'm very upset.
It's something that you always...
Yeah, they talked about this before spring break even got here, about the rodeo. They've been talking about corn dogs, funnel cakes, fried Oreos, and look, I'm not buying the food. If they shutting it down, why would I buy the food?
Thank you, ma'am. Yeah.
So we show livestock, and we look forward to this. So if you have a steer, you get this steer about a year in advance. So I got my steer in like March of last year, and I spent about $6 grand on him, sending all this money to, and it's day by day. It's not just like you prep a week before show. It's every single day. You're waking up at 6 a.m. in the morning. You're going to feed your animals. You're going to wash your animals, and then after school you go as well. And this is every weekend that you go to with this animal. It's every single day. And for somebody just to say, like a day before we show, we're not having the show now, that's at least 50 grand down the drain. And this is people that like spend, like this is like how we get to college. Like it's not like just like something we do for fun. Like we're coming here to get money to come to college. Like it's not, it's very, like we're learning so much by having these experiences. And like I get like Corona's like a big thing, like, but like let people have it at their own risk. Like it's not something that you should just take away from thousands of kids. Like it's not just like 10 kids. It's at least 4,000 kids that are coming here to show that spend at least 50 grand on an animal.
Again, I talked to another student that was in tears talking to me about it. I can see the water in your eyes. How are you just trying to comprehend and cope emotionally with this?
It's just, I've spent so much time with my animal, and like, yes, like people say, it's bad. Like you're coming here to kill your animal. It's not just that, like our animals live good lives. Like we go there, like we spend at least, I spend at least 6 hours a day at the barn with my animal. And if you think like that's a fourth of my day, yes, that's a fourth of my day, like every single day that I spend with this animal. And it's not just a steer, it's a heifer, and it's a goat, and it's all these projects that we've worked so hard for. And just for that to be ripped away from us, it's just, there's no point.
Thank you very much. And we're gonna go back to you guys back in the station, but that's the impact. So you can hear these kids, 6,000 on the steer, been working on it. They need this money for college, and then now they're all of a sudden they're out. So we're gonna talk to some more people and share some more stories, but it's just heartbreak and confusion is the best way that I can put it right now here at Rodeo Houston as we wait for word on what's going to happen next.
Very good. Thank you, Nick. Appreciate that reporting out of there, getting some compelling interviews. Nick Notario live now at, the Houston Livestock Show and Rodeo. And what we know now is as well that they're not allowing people on the rides.
Right, and we actually are able to see that sky is hovering over the carnival right there, and you're able to see people walking away from those rides. Listen, we have Nick Notario there on the ground at the rodeo, but at the press conference, we have our own Maya Shea. She is there set up, and she's waiting to get started. I mean, Maya, I'm sure you heard Nick's interviews. What can you tell us as far as you know right now? I know it hasn't started yet, but...
Yeah, we know that Judge Lena Hidalgo and the mayor are conferring right now. They will be addressing people right here. And we also expect the city health head of the health department, the person you've seen, Dr. David Purse, to be here, as well as county health officials. And look, it is devastating for these young people, right? But what they're going to say, and we expect them to tell us specifically, is why they take this so seriously. They want to stop community spread, and that is the fact that if one person brings one case to an area where you got 60, 70,000 people in close proximity to each other, it could spread to one person. That person can take it back to their community, spread it among their schools, their church members, all of those things. That's what they want to prevent. When you're looking at cities and countries around the world that really have major problems, the seriousness of it really comes from it spreading in the community. So what health experts have said for a long time, in the last 2 or 3 months they've been dealing with this, is about containing the virus and its spread. And that, we expect them to emphasize that point relating to the decision to close the rodeo, which I know so many people love the rodeo for a variety of reasons. And the fact that it's closing, one is to know that the officials have thought long and hard about this. They clearly didn't want to do it, or else they wouldn't have started the rodeo at all. And we expect a lot of folks to give us specific information, and now, talking to a lot of my sources, they're concerned that before it's all over, we're going to say something like, man, we wish we never opened it, right? Because what if there are other cases? You just heard that case in Montgomery County this morning, the presumptive case. My own child's school, St. Thomas Episcopal, sent us the email late last night saying, we're closing the school, right? Because one student may have been exposed to their sibling who was possibly exposed. They just want to prevent that. And, you know, an ounce of if you can prevent a couple of kids from getting it, a couple of adults from getting it, then you can prevent community spread. You also have to think about the cost it is to our medical facilities. You know, we have the biggest and the best in the world, but it's not endless, the supply of healthcare, the limiting of tests, which we have heard from local health authorities, the fact that they cannot rely on the federal government. Those are all issues they're having to deal with. So when they decide to shut something down like the rodeo that's so big in scope, they're looking at all those elements. They're not just looking at, okay, whether or not there's some spreading of germs at the carnival rides, or whether or not kids are too close to each other when they're showing their animals. It's absolutely, So that's what we're expecting. I see some health officials here. Yes, go ahead.
Maya, now when they announce that it's going to be shut down, is that going to be effective immediately, or is this something that's going to begin tomorrow? I mean, right now at the rides, at the carnival, Nick is saying that people were in line to get on the rides, and then they suddenly said, sorry, we're not accepting any more people here.
I think it's going to be like as soon as possible, but you're still talking about thousands of people there. Hopefully the judge and the mayor will offer some clarity to that. But certainly, if you bought your carnival packs, like I have as a parent, we have reporters working on those answers, and we will bring you that throughout the day. But I think at this point, what public health officials are saying is like, we're trying to stop our communities from becoming like China, parts of China or parts of Italy or other communities where you have their medical facilities stretched to the limit. We don't want to beat that, and we don't want to get there. And so if that means some discomfort about our most beloved event, they'll come back next year. We will have the rodeo again. And I think that's the point, is they'll have all these festivals, events, things will continue. But first you have to stop the pandemic. And especially with the World Health Organization coming out, just saying that they can now call it a pandemic. You're talking about dozens upon dozens of countries, over 1,000 cases in the United States. These are very serious issues that affect a lot of people, overwhelmingly older folks. And people are thinking about all sorts of things. You got to think about, we have prisons here, we have healthcare facilities, we have senior facilities, a lot of places where people who don't have the luxury of just quitting where they're at and being at home, right? They don't have that option, and they're all concerned. You have to think about all of their health as well. So it's not just you and I who might be perfectly healthy. It's about the people next to us and the people next to us, that person and that person.
Because that's a great perspective.
Absolutely.
I mean, and then when you do think about that and you put it into perspective, I mean, South by Southwest, another major event canceled. The St. Patrick's Day parades across this country, Boston, one of the biggest ones, canceled. Schools across the country, Maya even mentioned her school, her child's school, canceled. And this is out of an abundance of caution. And we are covering this on all sides, though. We want to hear from the people who are affected, and we also want to hear from those who are concerned.
And we understand a lot of the interviews that Nick was pointing to, and those, from the young to the old to the middle-aged, most of them were upset that it was canceled. Most of them were like, what? I can't believe this. Why? I think it's overreacting. But then some begin to understand, you know what? I guess we have to be cautious here.
Well, right. And we understand. They put in a lot of hard work.
They sure did. They sure did.
And they're looking to get their money back for their animals, but also the scholarships involved. There's a lot involved. And as Maya said, on the other side, you have the rodeo committee and the CEO, as well as the Houston Health Department and the mayor and the Harris County judge. They are all working together to try and protect the community as well. So we're covering this from all sides. And also, we hear you on social media. We hear you on Facebook. We hear you on Twitter and Instagram saying, well, what do I do next? What's next? I was going to one of the 11 concerts remaining. Will I get my money back? We are trying to answer those questions as well. You should see our newsroom now. We are running around on the phone. We are trying to get all of the answers for you right now.
And we will certainly get them to you and bring it to you right here on ABC13.com, or of course online as well, because a lot of those questions need to be answered. Because we're talking about as well, not only this, and the reason we're here breaking in live to your normal, noonday program is that this is such a profound thing. Yeah. This has not happened in 80 years. Here in Houston. This rodeo has been a continuous contributor to the Houston economy, a continuous and ever profound impact, and sort of an iconic month and 3 weeks of concerts, of fun, of carnivals, of 100,000 people gathering practically every single day. And the economic impact alone is into the hundreds and millions of dollars. Bree Berry following that. Bree?
Yeah, so as Tamika was just saying, we're running around the newsroom trying to get these details, and we don't have all the answers to everything going on, but something that we are going to have to think about, and I'm sure a question that Nick is out there asking those business owners, or Maya at the press conference will ask the mayor, is, this economic impact. So I think it broke all of our hearts in the newsroom listening to those young women talk about the fear that this could impact college. And we do know that just alone with the rodeo, we're talking millions of dollars. Last year in 2019, they gave out almost 20,000 scholarships to these young kids who come out here and compete. Yeah. And like she said, this is money that they have an opportunity to win back, money that they've spent on their steers, money that they've put into each and every day with their animals, coming to these livestock shows, the time it takes, the transportation, their family completely picking up, staying and lodging, and then they have an opportunity to win that money back to go towards college. We're talking millions of dollars that was given out. I think it was $840,000 to start just with a couple of the scholarships. So I know there's a real fear there. I'm looking at this economic impact study that we have here that was released by the Economic Analytics Consulting LLC from last year. And just the rodeo directly generated $133 million. It was almost $230 million in the surrounding area. So we're talking about people who are go to the rodeo, but then maybe want to stop by a museum or, eat out at a restaurant. And Nick was talking about the businesses, they prepare all year long.
Oh, yeah.
All year.
Yeah, they do.
The auction, the art show, all of this will be affected, and it's something to think about. But I will say, Houston, we've dealt with a lot, and we're a community that bands together and finds a way to get through things. So whatever the economic impact or the fear that we have going on right now, it's best to sit back, let us gather these details, answer your questions, and we'll do that.
Yeah.
All right, very good. Thank you, Bree. Appreciate
Absolutely.
you reporting on the economic impact.
Let's go back out to Nick Notario there on the ground there at the livestock. Oh, you are inside now.
Inside the exhibition hall now, yeah.
Yeah, the most emotional stories we heard as we broke this news were from the kids that are here showing their animals, the livestock exhibitors. So we wanted to come in and chat with them. A lot of them were crying. We're so emotional talking about it. So we wanted to show you the impact of what this is going to be. This is Savannah and her calf that was just born. Savannah, tell us how you all are feeling dealing with this news.
I'm honestly feeling very heartbroken because this is my first show with the baby on the ground, and I was hoping to come in and, you know, get some positive feedback about him, but now I can't with the rodeo canceling, and this is actually her last year showing at the Houston Rodeo. So that broke my heart knowing she won't have her last major show. So, and I just hope maybe they can change their minds and continue it.
Jasmine, you're one of the exhibitors here as well. Tell us how devastating this is for you all, and especially when it comes to having money for college and everything else.
Yeah, so the money problem is really a big deal, of course, because not only scholarships and the money that we put into this as well as the time, but the leadership skills, the responsibility, everything that we learn and that we gain from this is being taken away. Because yes, you know, we get here really early and, you know, we're tired, we're sleep deprived, our parents are, you know, driving us back and forth because we're from Spring, Texas. We're just north of here, maybe 45 minutes, but a lot of people are from the Panhandle, Oklahoma. A lot of people come far away to come to this show, and the fact that it's going to be canceled is really heartbreaking, and it's sad to see happen because of so much that's being put into it. And to know that, you know, the money is a big deal, again, because not only scholarships and getting into school, because a lot of kids depend on this. So a lot of kids, you know, they do the calf scramble because they don't have the money to get a calf. So they do the calf scramble, and then they get money from the calf scramble and the scholarship to go to college. And a lot of scholarship recipients are first college kids in their family. So the Houston Livestock Show and Rodeo really does a lot for us kids in Houston and all over this great state of Texas.
Okay, thank you very much. And we're going to go back to you all as this news conference we're hearing is about to start. Here you go.
All right, very good. Thank you, Nick. Yeah, they are filing in right now. We'll go ahead and listen in. There's Mayor Sylvester Turner. He looks like he's going to go ahead and start speaking first.
Let's listen in.
You have on his side Judge Lina Hidalgo. They haven't started speaking yet, so I'm just kind of making some introductions. But and then you have there as well health officials who are going to be joining in. Dr. David Pearce is the leading health official. He'll be joined. You can see him there back behind the mayor, behind the county judge as well in white with a white mustache. As they get themselves situated, again, this is a news conference to talk about the shutting down of the Houston Livestock Show and Rodeo.
Let me say good afternoon. And I'm standing with County Judge Lina Hidalgo, Dr. Shaw, who's also from the county, Dr. Pearce, the City of Houston Chief Medical Officer, Chief Pena, Chief Acevedo, a number of department heads, Susan Christian over special events, and then a number of our city council members, Vice Mayor Pro Tem Martha Castek-Tatum, Councilmember Robert Gallegos, Councilmember Tiffany Thomas, Councilmember Amy Pag, Councilmember Abby Kamen, Councilmember David Robinson, and Councilmember Carolyn Evans Shabazz. And then I think I mentioned Joel Cowley from the Houston Livestock Show and Rodeo, a representative from Congresswoman Sheila Jackson Lee, and other persons. Let me just say the reason why we are here today is, of course, it's the coronavirus, and to kind of bring people up to date as to where we are as of today. And up until yesterday, all of the cases that had been confirmed in Fort Bend, Harris County, City of Houston, all of those cases had been related to international travel. And all of them, with the exception of one that traveled to Italy and came back, were directly tied to that Egyptian cruise line. And that was up until yesterday. And then, of course, on yesterday, We had the case that was confirmed in Montgomery County that was not tied to international travel and appeared to be a situation that was took place within our region. And when I say Montgomery County, I count that within our region: Fort Bend, Harris County, Houston. And that changed things. And as a result of that, we said that we would monitor this situation very, very carefully, and that we would make the necessary adjustments as we went along to make sure that we were doing everything that we needed to do to keep people safe, based upon the facts, the science, and the medical advice that we were being given. And so yesterday changed things, because yesterday with the case in Montgomery County, that was evidence of some community spread. And as a result, that takes us to what do we do next? I will tell you by the end of today, I will be signing an emergency health declaration for the city of Houston. And I'll also, Judge Hidalgo can speak to what the county will be doing, but we're both on the same page. And so at the end of the day, I will be signing an emergency health declaration, and which will remain in place for 7 days as we continue to assess the situation. And then depending on where we are at the end of that 7 days, then City Council will have to vote to continue that emergency health declaration. But that will take effect as of the end of the day today. What does that mean? That means as it relates, for example, to the Houston Livestock Show and Rodeo, that we deeply love and support. They are impacted and directly impacted by the decision and the changing of events. And I will tell you, it's not an easy that has come to easily. But after conferring and talking with the stakeholders, and we all have the utmost respect and love for the Houston Livestock Show and Rodeo. We are all in agreement. It is a decision that is being made in the best interest of the health and safety of people within our region. And so as of today, starting tonight, the concerts will come to an end as they will phase down. And it will also impact the remaining concerts and events at the Houston Livestock Show and Rodeo. And let me just add, that is not the only event that will be impacted. As you all know, this coming week is the Tour de Houston. And the Tour de Houston will also be rescheduled. And if we cannot reschedule it, it will be canceled for this year. And Susan Christian over Special Event, and I know their teams, have been working very, very hard. But that event will also be either rescheduled or canceled. And for the event in the month of March, as it relates to the city of Houston, those events that are produced, co-sponsored, and permitted, those events will be impacted as well for the duration for the month of March. And so that would include, for example, our capital improvement program town hall meetings as of tonight. Scheduled for tonight, scheduled for tomorrow. Those meetings will be rescheduled for the months of April and May. And so all of the events for us that are city produced, co-sponsored, and permitted for the month of March are going to be either rescheduled or canceled. And let me tell you why. Again, changing circumstances, and I've said from the very, very beginning that when we are confronted with the facts, medical advice, counseling, the science, that we would not hesitate to act. And I will tell you, for those of us who are Texans through and through, and from our area, from our region, you know just how much we love in the Houston Livestock Show Rodeo. So you know that this decision has not come easily, but the health and safety of the people in our region is paramount. And it is important for people to know that based upon the facts presented, we'll make the necessary decisions to keep everyone safe. And that's what we will do. And so we'll carefully monitor this situation. And I am saying for the month of March for the city of Houston. And then the county judge and I are going to huddle a little bit later on today. And we will sit down and coordinate responses and steps that we need to take as we move forward. I want to thank the county judge for her collaboration and partnership. The county has just been an incredible partner, and I want her to know, and I want to say it publicly, appreciate the support and the leadership that she has provided along with her entire team. And with respect to my team, Dr. Purse, Stevens Williams, and Dr. McNeese, the entire health department, I certainly want to thank them. But I do want to really appreciate Joe Cowley and the entire Houston Livestock Show and Rodeo team for their support and their cooperation. Now let me pause and let me bring up Dr. Purse, and then followed by County Judge Lena Hidalgo. Dr. Purse.
Thank you, Judge, and thank you, Mayor, and thank you, Judge, for being here. I just want to remind everyone why we're doing this. This virus is new to the human population. None of us have any immunity to it. We don't know how wide it's going to spread. We're watching around the globe, and we're seeing many communities, many nations coming up with many, many cases, and the spread is occurring very rapidly. Within that spread of the people who get ill, we do know that about 80% of those folks have minimal or mild symptoms. To some degree, that's a bit of a problem because those folks are probably the ones who are spreading it throughout the rest of the community. There is a subset of the population, there's about 15% of the population who requires hospitalization. There's another percent of the population who's requiring intensive care level care, and they're on in critical condition, and we're seeing waivers, the number of waivers, but we're seeing about a 2% death rate from this. So the death rate appears to be predominantly in people over the age of 50. That seems to be the highest percentage. But depending on which decade of life, 50 to 60, 60 to 70, 70 to 80 or above, it's 5, 8, 10, as much as 15%. We're doing this in order to save lives. This is a very big step that the mayor and the judge are taking, but it is to save lives. If we are successful with not only the things that this community can do, what government can do, but what you can do in terms of social distancing, washing your hands, covering your cough, not going to work when ill, those things, when we do those together, we can slow down the spread of the virus through our community. And it's important that everyone understand that that is what did not happen in Wuhan. It exploded in Wuhan. They didn't know it was coming. They had no warning. They had no time to prepare. They had no ability to slow it down. And it completely overwhelmed the community and, importantly, their healthcare system to the point when people needed a hospital bed, there was none available. What we are trying to do with these very aggressive and, yes, painful decisions is to slow down the virus, because we have every reason to expect that at this point, hopefully I'm wrong, but we have every reason to expect that it can spread to many, many people in our community. With 80% of the folks having minimal or mild illness, if that happens over a long period of time, we'll be able to handle that. But for those percent of folks who need a hospital bed, there needs to be a hospital bed available to them. So if everybody gets sick at the same time, we won't have a hospital bed available. And afterwards, we have a graph over here to the right, a chart that you can look at. We can talk about it later that kind of shows that in a graphic form. But I want to remind everyone that everybody up here understands how difficult these decisions are, how painful it's going to be to some folks. But we're doing it in order to save lives of real people. And if we are successful, we will look back on this and say, well, you know what, it turned out not to be such a bad deal. Well, if that's the case, and we're seeing what's happening in Italy, for example, then that will be because of all these things that we have done. It won't be because those things were unnecessary. It will be because of the steps that we're taking, like the steps we're taking today. And the option is to not do these things, in which case we would certainly expect to have a Wuhan situation. That is not acceptable. So as painful as these things are, I want to remind everybody, we're doing this in order to save lives. Thank you.
County Judge.
Thank you so much, Dr. Peirce. Thank you, Mayor, and to all the council members here, the department heads, everyone for your collaboration. It truly is a regional effort. I was on the phone with Montgomery County just before this. We've been in very close contact with Fort Bend County, and we all recognize that this virus does not respect political boundaries. So we're working very, very closely together. I know that the anxiety in the community just continues to grow as we hear the news of spread in other areas of the country, areas of the world, and of course, news that the rodeo will be canceled will only add to that. And so I want to acknowledge the concern that we all feel given the the fact that we're still trying to understand this virus and that ultimately it's a health issue. And so first, of course, the rodeo will be canceled. They'll begin winding down starting today. And as the mayor mentioned, we will be working together to assess what other steps need to be taken. I will also be issuing later today a disaster declaration for Harris County. Yesterday at Commissioner's Court, we directed all our departments to prioritize coronavirus preparedness over and above anything that is not an essential function. And we are working very hard with all of the hospitals, with businesses, with schools, as we have been, to ensure that we not only have plans, but that we've exercised those plans, that we've identified weaknesses, and that we're preparing for whatever will happen or may happen with the virus. I do want to make clear, for some time, and especially this weekend, it became very evident that we are facing limitations as to our testing capability. And I've mentioned this somewhat. There are folks that we had to wait for state approval on for that test to be able to be sent to the city lab or to be sent to the lab in Atlanta. And so there are many more folks we could have tested, but because of the lack of tests we've received from the federal government, we've had very limited capabilities. Over the last couple of days, it's become clear that that may have give us, in a sense, an undercount, if we want to put it that way, of what the community spread may have been. And so we were already working toward the step that we're taking today with the rodeo, and we were already working toward further steps. The positive case was identified in Montgomery County, but we know that that individual may have had contacts throughout Harris County. We know that it is only possible and very likely that there are other cases like that going on in Harris County. And so I want folks to know that we'll be working hard to continue to be proactive, understanding that if we had the capability to test more people, we surely would be having more positives and perhaps more evidence of community transmission. And so at the county, we'll also be evaluating our county-sponsored events, but most importantly, hand in hand with the mayor and other jurisdictions, what other steps we need to take right now. Very important for folks to recognize. We are not a hermetically sealed community. We can't do that. We are not an island nation. We can't close our borders. We can't do what some of these small countries have been able to do just here as a county or as a city or as a region. And so we have to recognize that it's possible that despite our containment efforts, it's possible, if not likely, that we will see wider spread of this virus. And so that's where what Dr. Peirce said is very important. This disease, 80% of the people who get it have mild symptoms, like a mild flu. That 20% are the people who are going to need to be able to access our hospitals, the 20% that see themselves more affected, the small percentage that may be at risk of dying from this disease. And so we all have to begin putting into perspective right now what those statistics are, because as much as we're working with the hospitals to ensure that they have the areas cordoned off, that we have the hotlines for folks to call who don't have health insurance, the hotlines folks can call who are undocumented, ultimately we're all going to have to continue to play our part, not only on social distancing, not only on staying home if we're sick, not only on washing our hands and not coughing into our hands, but also in ensuring that we are not, flooding the hospitals or the doctors unnecessarily, those of us who know we are at low risk of being affected significantly by this virus. And so I want to make sure folks know we are working in coordination. The rodeo is being canceled. We are discussing any other options, any other steps we need to take right now, but containment will not be foolproof. It can't be, given the nature of our community. We are doing and will continue to do the best we can for that, but we are also very much focused on what our role is and will be in the event that this becomes more widespread, not just us, but everyone else in the community. I know a lot of folks had plans for the rodeo, perhaps for the tour, for some of these events that are going to be affected, but we all need to do our part. We need to stay informed, stay calm, and recognize that this is a community-wide response that we can't just do as government. En español, repito.
You've been listening to County Judge Lina Hidalgo. She's been talking a lot, of course, about the impact of the coronavirus. COVID-19, now delivering her remarks in Spanish for the Spanish community. But you heard there from Dr. Peirce as well. We know nothing about this disease yet. There is no cure. There is no, we don't know how far it's going to spread. We don't know how quickly it's going to, the virus can accumulate other victims as well. And so that is the reason why they've decided to shut everything down.
It's something very, very poignant that he said, Dr. Peirce. He said this, quote, "We are doing this in order to save lives, real lives of real people," saying that they have every reason. He says he hopes it doesn't happen. But because of the case in Montgomery County, the mayor is saying that it was the case in Montgomery County that appeared to be a community spread that caused all of this.
Right.
Meaning, saying that, the rest of the cases seem to have been linked to a trip to Egypt. When this particular case came out, and this particular person in his 40s in Montgomery County had not left the country, and this case seemed to be a community spread, he said that is when they came together, put their heads together and said, listen, now is the time to shut things down.
Yeah.
And Dr. Peirce saying that he hopes it doesn't happen, but they have every reason to expect it can spread to many communities, and they are doing this out in an abundance of caution.
Well, and we expect it to continue to spread. We expect the numbers to continue to grow. I mean, it's the natural consequence of just this virus taking its course. Eventually, as it is in China, in fact, the numbers have been stabilizing and, in fact, declining. But here in the United States, they're certainly not doing that. Right. Now we have over 1,000 cases here in the United States.
Right.
And we have over, I believe, 30 deaths now.
And here in the Houston area, we're talking about 14 cases
14
now,
cases
including
right now
the Montgomery County case. Now, listen, we do want to speak directly to our viewers here. We hear from you. You are talking to us on social media. You're talking to us on Facebook and Twitter and Instagram, and you want to know what's next. If I bought tickets to the Houston Livestock Show and Rodeo, if I have concert tickets, what do I do now? Do I get my money back? Now, we've been researching, and I wish we could have a camera there in our newsroom. People are running around. We're on the phone. We're trying to contact the rodeo, but here are some updates that we do have. StubHub says that if you have a ticket, they will refund
they will honor.
They will refund it.
The organization Houston Tickets as well, they will also honor our refund. I suspect that all will honor our refund. Once you have large organizations like StubHub, ticket holders like StubHub,
right,
and others honoring a refund. And as well, if you purchased it right there at the ticket office from Houston Rodeo, that a ticket refund. Okay, we understand that the Houston Rodeo is now saying that a ticket refund process is in the works. That will be determined a little bit later on, but it is in the works and it will take places. And it will be communicated once it is finalized to all individuals.
And don't worry, if you didn't get all that information, we do have that for you on our ABC13 app. In fact, right now we have a lot of information.
Yeah.
We are working overtime in our newsroom right now.
But you know what? Something else that was canceled is the Tour de Houston.
Right.
That's this weekend.
Right. There are
That's
so
a
many
huge
things
event.
affected.
I mean, that affects thousands as
That's so
well.
true. That's
The
so
Tour
true.
de Houston has been canceled. It said it has been postponed. If they are able to find another date for later this year,
then they will reschedule.
Then they'll go ahead and reschedule that. But if not, then they will not. Now, of course, the rodeo, that has been canceled. It will close at 4 p.m. today, and it will be over. And they will not reschedule the rodeo. This is not going to happen until next year again.
Right.
Yeah.
And if you watched our elected officials, their faces, you know, this is something that's very hard for them as well, according to them, right? I mean, we saw the CEO, Joe Cowley there. We know that this was a very hard decision to come to for our officials. But them saying that this is just to make sure that they try and keep this community safe. I think the person who said it best, if I do say so myself, Dr. Pearce. I mean, he has all the information, and he says that it is time to take this serious, and they are doing this out of an abundance of caution for everybody involved.
You know, and this is, and we're not an aberration here in Houston area. This has been taking place throughout the country. New York, of course, has hundreds of cases there as well, thousands, in fact. But what we have.
Thank you,
Let's
Judge.
go ahead and listen in to the news
Mayor,
conference as it continues. This is another health official.
I wanted to, first of all, my name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and the Local Health Authority for Harris County. And I want to just add to what the Mayor and the Judge have said, as well as Dr. Pearce. It is important to remember that we have been talking about novel coronavirus from a standpoint of both monitoring and response, from the standpoint of if to when to now. And I think that is the important piece of this that is really about what's happening in our community. Dr. Pearce has laid out all of the different activities that the two health departments have been working on. Dr. Pearce and I, Stephen Williams, the City of Houston Health Department Director, have been connected. And it's not just the two health departments being connected, but our regional public health partners have been connected over the last few months to really understand what has been happening globally, what's been happening now domestically, and now what's happening here locally. So we know that these decisions and these activities that everybody has planned for are difficult decisions for us to make, but also for people in the community to partake in changing plans and making all those other aspects of what potentially could disrupt what their activities have been planned for, scheduled for. But we also recognize at the end of the day, the number one priority for all of us is to protect our community, the health and well-being, the safety and security of our community. And that's why we have moved forward with this step. And I do want to say that there absolutely important is that change with the Montgomery County situation, that has really been a significant change. We know there is a lot of evolving information here. And we also know that on a global standpoint, the World Health Organization, WHO, just within the hour, has now declared COVID-19 a pandemic. And so that really highlights how seriously entities, decision makers, and responders are taking COVID-19 across the globe. And I think it's very important for us to continue to emphasize what we've been emphasizing throughout, which is one, that we want people to take all the precautions that they can, especially, as the mayor mentioned, those who are elderly, those who have chronic health conditions. We want to make sure that you limit your interaction with those who may be sick or those who you are concerned about. We also want to make sure that if you are sick, that you don't go into settings, whether it's at work or sending your child to school, that you do not get others sick in our community. And when we say community, Judge Hidalgo and Mayor Turner absolutely are correct in that it is not just Houston, Harris County. It is our community at large, our entire region. We know people move around. We know people work in one place and live somewhere else. We want to make sure that you're taking all the precautions, not just for yourself and your family, but for your neighbors, for your elders nearby, for the people that are really most at risk. We want you to take all the precautions to help them stay healthy, safe, and protected. And finally, we're also saying make sure you remember all those personal hygiene and personal protective measures that we've been talking about, everything from the assurance of hand washing and certainly using hand sanitizer when not able to use soap and water, which again, as a reminder, is the #1 way to fight against a variety of respiratory conditions and infectious disease conditions is not hand sanitizer, it's actually soap and water. So I know there are a lot of concerns out there about the hand sanitizer, but soap and water. And then the other piece is certainly cover your cough, and there are a variety of both information that we've been giving out there. And I think it's important for us to remember that it's not if and when, it's now. The final thing I want to say is that both health departments have set up hotlines for information. There's information that's available at Harris County Public Health. There's information at the Houston Health Department. We've also stood up a information line with our Harris Health partner that's also information for clinical questions that may be coming up from the public. So between those, or amongst those 3 local resources, we're also pushing everything we can to assure that information is out there through our websites. You can go to readyharris.org, as well as the websites for the city and the county, as well as obviously the state and other federal partners. It is absolutely important that we give ourselves all of the information so we can make good decisions for ourselves and our family. Thank you.
Joel Cowley, President of Houston Livestock Show and Rodeo. Joel.
Thank you, Mr. Mayor. First and foremost, I want to thank the city and the county for their professionalism over the past week. And I also want to recognize Dr. Kelly Larkin, one of our volunteer vice presidents, for her efforts in making sure that we took every possible precaution on the grounds during the first week of the Houston Livestock Show and Rodeo. So we have been in constant communication with the city and county health departments over the past week and really operating under their guidance. With the evidence of community spread, obviously things have changed, and we will respectfully and dutifully comply with the order to cease our operations. As heartbreaking as this is for our millions of fans, our 35,000 volunteers, our staff, our exhibitors, and our contestants, it is the right thing to do in the interest of the health and well-being of the community. And so we have implemented procedures to do an orderly wind down of our operations. There, as the mayor earlier stated, there will be no rodeo and no concert this evening, nor for the remainder of the show. We do have some livestock and some horse shows going on, and we will wind those down today as well. With regard to those who are on our grounds presently, we are requiring that they depart the grounds by 4 p.m. And for those who are holding pre-purchased items, whether those be tickets or whether those be carnival packs, we will be posting refund information on our website. So please be patient with us as we get that information out. One of the other questions that I've received is, does this mean we will not be giving scholarships? And I am happy to tell you that due to the foresight of our executive committee, we are in a position to fulfill our annual contribution and commitment to youth and education. And so we thank the city and the county for their support in this. As hard as this is to do, it is the right thing to do. And we definitely thank the community for the support of the Houston Livestock Show and Rodeo as well. Thank you.
Thank you, Joel. I do want to recognize Jay Carrero with Senator Cornyn's office as well. Thank you, Jay, for being here. And let me just say in closing, the Houston Livestock Show and Rodeo has been and continues to be an incredible partner and asset to our region. It goes far beyond Houston, Harris County, Fort Bend, Montgomery County, you name it, an incredible asset, resource. And so let me thank the Houston Livestock Show and Rodeo, and they took just additional steps to prepare to keep everyone safe, and so that's very much appreciated. Let me also say, what does an emergency health declaration means? So when it comes to, it will give us greater abilities to manage our resources, flexibility with the procurement process, in acquiring assets, and hopefully in getting federal assistance as well. And those are the primary reasons for the emergency health declaration. I want that to be clear because I don't want everybody to think that we need to get in a panic situation. So let me just tell you why we are doing it. From a contractual point of view, procurement point of view, managing resources, getting federal assistance, those things are important. And so that's the purpose, that's the reason why we are putting forth this emergency health declaration, both the city and the county, by the end of the day. Another thing that I want to bear in mind is that we're working collaboratively. And so the month of March, let me speak from the city's vantage point, from the month of March, we have school districts that are already out on spring break, like right now. We have big school districts like Houston Independent School Districts that I think will be out on spring break, like next week. Okay, and you have University of Houston, I believe that's out right now. Rice is out this week as well as next week. So they're out right now. And so by canceling or rescheduling a lot of these activities right now in the month of March, it kind of helps to contain and mitigate. Because now with the rodeo not taking place right now in this time period, with Tour de Houston not taking place, with the city, for example, rescheduling and canceling events right here in the month of March, the goal is to do everything that we can within reason to contain and mitigate. That's the goal right here in the month of March. And so even though there are only 2 confirmed cases in the city of Houston, we are regional, and people travel from one part to the other. And we are totally incorporated within Harris County, and Harris County covers a large area. And people in Montgomery, Fort Bend, we all go back and forth. And so the goal is if we can significantly slow things down, and for people to, while we assess what's out there, because we really don't know what's out there, but it does provide for people who are traveling internationally. For example, if they're coming back, 14 days self-quarantine. That's what we're saying. We're saying that people stay away if you travel internationally from nursing homes or senior living facilities. We're saying that. For those who are elderly with underlying medical conditions, we're saying stay away from large crowds. And so those messages we continue to say. But again, I do want to emphasize this is not a time for people to panic. Okay, or be fearful, you know. Yes, you can go to the store and buy the soap and buy the sanitizer. And quite frankly, as I've said before, I never go home without it, you know, leave home without it. You can do that. But purchasing the toilet paper, I don't get that one. That one I don't get. So let me just say, we said we will make decisions based on the facts, the science, and the medical advice. No medical physician, doctor, anyone has said anything about, for example, the toilet paper. Okay, so I want to say that, and then I want people to understand the decisions that we have made for today, even as it relates to the Houston Livestock and Rodeo, was not just made in a vacuum by the county judge or the county or the city. We have had these conversations with the Texas Medical Center. We've had these conversations with almost all the CEOs, the hospitals in the Texas Medical Center. And I can rightfully say to you, we are all on the same page. Because the number one concern is to do everything we can to maintain the health and safety of the people in our region. And we said we would watch this situation very, very carefully. And as the facts change, our strategies would have to change to correspond to those facts. And the situation is still fluid. But the goal in the city of Houston and in the county and in the surrounding region is to recognize when conditions change and then to do everything we can to be proactive, to contain, and to mitigate. And if we do that collectively, then we will come out of this situation and we'll move forward, okay? So with City of Houston employees, I still expect for you to show up tomorrow, and I still expect for you to work the entire day. In fact, I expect you to work the entire day today, okay? So we're going to continue to go about our business. We're just going to do it in a very smart way, and that's the goal. Having said that, we'll take any questions that anyone may have.
Mayor and Joe, can you address the fact that my sources tell me that this individual in Montgomery County attended the rodeo, and that is part of the reason why you guys took such immediate action today, and that he was actually there for certain days?
Dr. Percy, you want to take that?
The action being taken is because of community spread. And as the mayor pointed out, and as we all know, we move all over the community. And so this individual became infected. We don't know how, which means there is likely another person in the community. And so we suspect that this is, potentially a tip of an iceberg, and there may be many people throughout the community who are infected. So that's why we're taking these steps at this point. And as the mayor pointed out, this is an issue of large gatherings that we're talking about. So the bike tour and other large gatherings, all the things that the city, as he pointed out, are sponsored, permitted, I can't remember what the exact phrase was, but those are all being, because we know that the virus is no longer, when it was related to that Egyptian cruise, we knew who those folks were, we knew who their close contacts were, and we felt we had it contained at that point. But we all knew that it was probably a matter of time before this was going to happen. So now that this has happened and we have community spread, this isn't about the rodeo, this is about large gatherings and protecting the community.
I understand, but if he was at the rodeo at a specific barbecue tent or at a specific incident, wouldn't those people who attended the tickets for those tents, who work security, who are volunteers, want to know? And are you letting those people know?
So,
that question
yeah.
is not being answered. And
So,
especially if he went to a concert, a specific concert.
It was not.
Well, okay.
Let's be, because I hear your question, let me be straightforward. There is some indication that he was at the barbecue cook-off.
That's what I'm asking.
Right, he was at the barbecue cook-off, and then we are tracing to specifically find out where he was, okay? But not at the concert. He didn't attend any of the concerts and anything of that nature. But there is information that he was at the barbecue cook-off, and then we are trying to trace back.
Was he a volunteer or an attendee?
That I'm trying to get information on.
So one thing to add, and I appreciate that question, is obviously the teams, the epidemiological teams, have to go and do their investigation. And so they're still honing in on exactly the contacts of this individual. Obviously, people's recollection is murky. If we thought about what we did a week ago, it's hard. And so they're trying to trace this gentleman's steps, and based on that, we'll put out additional guidance if we get something concrete. Our best understanding right now is he was at the barbecue cook-off on the 28th, and they're still trying to suss out whether he had symptoms then, which would have made it a bigger issue, or whether he didn't have symptoms, which wouldn't have made it as big an issue. And so that's why right now we're asking everybody, if you're feeling sick with symptoms that could be related to coronavirus, please don't go to work, don't go to school. If anyone has unexplained, symptoms and have a sense that they may have this, they can contact your healthcare provider. Don't show up, because if you do, call your doctor. If you don't have a doctor, call our health lines. The city has one, the county has one. We're working with the state to try to have the same number. They're not there yet, so we're doing it right now. We have to have our separate lines, but we're cross-referencing to one another. Fort Bend has one too, and no matter if you have insurance, if you're undocumented, you can call our line if you think that you may have this. And so, but Maya, to answer your question, the decision was made because of community spread, and it's already something that we were thinking about given the undercount or the lack of testing capability. En español. Sí, espérese,
All right, you were listening in there to the press conference. So much information coming out of that press conference. Now, we do want to remind you, the reason why they say, the officials here, the Harris County judge, as well as the Mayor Turner, as well as the CEO, Joe Cowley of the Houston Livestock Show and Rodeo, the reason why they say they canceled the rodeo, they shut it down as of 4 o'clock today, is because of the presumptive positive case out of Montgomery County. This is the man in his 40s, resident of Northwest Montgomery County. Now, that patient, the results are still pending from the CDC. County officials say he has no travel history outside of the state of Texas. And that is why the potential community spread of the coronavirus, that is the reason why they decided today to shut down the Houston Livestock Show and Rodeo.
Yeah, you can really just point it back to this gentleman who contracted the disease or the virus. Not sure how.
Not sure how.
Because that's the big question. Where did he get it from?
But
that means others have it, you know.
Potentially community spread.
Exactly. Potentially community spread because he hasn't been traveling. So it must have been community spread. He was at the barbecue cook-off on the 28th of February. He mingled with plenty of folks there. He mingled with a variety of people after that as well. Let's go ahead and listen in to the mayor.
8:30 and 9 p.m. That I cannot speak to. I can't speak to that at this time. What I will indicate to you with respect to city-sponsored and co-sponsored and permitting and events controlled by the city for the month of March, we are canceling those. We'll continue to work with all of the other stakeholders in the city. At this point, we are continuing to assess our situation, but what I can definitively tell you with respect to city-sponsored, permitted, and controlled events, those events are being rescheduled or canceled for the month of March. And then we'll continue to work with the other partners and the other stakeholders in the city.
HIC's in class until Friday, 200,000 kids, their families. What is your, and the district has not told us much, they have a couple of teachers in quarantine, so somebody went to Italy or something, but what recommendations have you guys given to the school district? You know, about what to do. Should we have class until Friday? Do they want to make spring break 2 weeks? Things like that.
We'll certainly leave it up to them, but if they want to continue out the rest of the week and then they'll be on spring break next week, I think that would be consistent.
If I might add, Mayor, so with all of the school districts, the communication has very much been, and we're talking to all of them, if you see a child who is sick, make sure that they're not there. And so that's been a continuous communication. We've been asking them to plan for, you know, what it would look like to continue operations or what would happen if this becomes more widespread. As we discussed earlier, you know, we will be talking more later today given these developments. Obviously, I was at Commissioner's Court all day yesterday. Mayor was at Council all morning. And so we're going to talk about every other steps that we can take and should take, and we'll be making additional recommendations based on that. But right now, we just got news of this community spread. We've just now seen our testing capability limitations, and we're taking the steps as quickly as we can. We wanted to make sure and get this out today so the rodeo could shut down today and we don't have any more events later tonight. And we are having those conversations, and we will be making additional recommendations as appropriate. But let us have today to discuss that further.
Yesterday, Harris County Health announced a fifth case of presumptive positive, and the press release did include flight information for this woman. Why have you not yet released flight information for the several cases connected to the Egypt River Nile cruise?
So we released the flight information for a woman who traveled from Italy, from Italy, that we received that information, the positive case yesterday. We have evidence that she had symptoms on the plane, and even though we haven't received the flight manifest from the CDC, we wanted to make sure and inform the community just as we did with the church. With the other flights, the health authorities all spoke, and at the state level, the national level, the city or the county, everybody's in agreement that there were not symptoms at that point, and so that's the decision that the health authorities have made. We're of course checking on all of the known contacts that those folks have had, and so far we've not received any positives. I'll invite Dr. Shah also to share his perspective on that.
Sure. Thank you, Judge, and thanks for that question. So it was a difficult decision because we recognize as we get information out there, what naturally people start to do is say, oh, I was on a flight. I was on any flight, and then all of a sudden you start to add in information. So as the judge mentioned, one, there was symptoms before the flight. or during the flight, I should say. But in addition to that, we were being told that it was going to be some time before we were going to be able to see the manifest. That delay in being able to get the manifest made us trigger to, as the judge mentioned, to the next level, which was the best way to get this information out in order to at least understand who else may have been. And remember, there were this individual's in first or business class on 2 flights from Florence to Frankfurt, Frankfurt to Houston on March 3rd. We thought it was important to get that information out of really the hope to be able to identify other individuals that may have been in those classes. Now, it's very possible we're going to get that manifest today, tomorrow. But we were told that it was going to be several days, and we did not want to wait to be able to inform the public. And I think that's the most important thing. Now, as far as you mentioned about other flights, it's absolutely what the judge said, that symptoms, but it's also a whole host of other activities that our epidemiologists are involved in. Sometimes it means that we can have a very targeted, focused way of identify the individuals, and that's what our epidemiologists on both health departments, our regional health departments, are very good at doing. In fact, they do it much better than the physicians. Our epidemiologists are very strong at this. However, when they determine that they cannot identify, then that's the point when we may go further with a message to the community.
Mayor, Judge, is there any regret that these containment strategies weren't initiated earlier? I know that you alluded to the fact that the testing difficulties, that there was probably other cases out there. Should these actions have been taken before?
Let me just answer. I have no regrets, because we're basing decision based on the science and the medical advice and the facts that are presented. And let's bear in mind, this is a new phenomenon. We're in new territory. And everyone is making the best judgments around the globe to try to take the necessary steps to keep people safe, to protect everyone, and then at the same time recognizing that people still have to work, they still have to take care of their families and their kids, and they still have to pay the mortgage and the rent and the electricity bills. And so up to the point of yesterday, all of the confirmed cases in Fort Bend, Harris County, and Houston were directly tied to international travel. And with the exception of the Italy example, they were all connected directly to the Egyptian cruise liner. And then please bear in mind, as it relates to the city of Houston, there are only 2 confirmed cases in the city of Houston. And I cannot say that enough. Now, that's not to say that there's not community spread. And we are taking steps, regardless of whether community spread was detected in Houston or Harris County or Montgomery County. We're taking steps to contain and mitigate. Okay? And so that's what we're doing. With respect to Sarah Week, which would have attracted thousands of people from 80 different countries, that event was canceled. There are other conferences that have already been rescheduled for later on in the year. So the definitive steps have already taken place. Myra, with respect to the schools, I think what people need to bear in mind, the vulnerable population are seniors with underlying medical conditions. For whatever reason, kids seem to be dealing with this much, 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 much better. So the vulnerable population are seniors with underlying medical conditions. But let's bear in mind, we are in new territory across the globe, across the country, and we're all taking the reasonable, necessary steps based on the science, based on medical advice that's being presented to us. So, no.
Can Dr. Hurst or Dr. Shaw talk about, we have a big medical center, is there a capacity with our beds for how many people we can handle? Are you guys looking at adding additional beds? I understand also, and not to just put it all together, but some of the private hospitals like Methodist and HCA and things are working on possibly having tents.
We'll let Dr. Shaw and Dr. Hurst respond, and then we're going to end the news conference, and you'll be around for other questions.
So I'll start first because I was closer to the microphone, although I was hoping that Dr. Peirce would be able to answer this. In all seriousness, I mean, Dr. Peirce and I cannot thank him enough for his collegiality and partnership, and you all have seen us working around the clock together, and I think it's just a reflection of City of Houston, Mr. Williams' health department, as well as the county health department. All of our team members, our regional health departments, are just really incredibly, we're just fortunate in this region to have strong health departments. I should really say that. What I do want to say is that we have equally recognized that it's very important that we're working with our healthcare providers and our healthcare systems. And so we have been getting messages out, as you know, that our Harris County Public Health operates the regional HAND, the Health Alert Network. We have sent over a dozen messages out to healthcare institutions and entities and healthcare providers to get updated guidance to them. The challenge that we've had, and this has really been a global challenge, that this really goes in phases. And we are hoping that we can, as Dr. Peirce mentioned earlier, delay or bend the curve so that surge is not required within the healthcare entities across our system, not just in Texas Medical Center, but throughout our region and throughout the state and beyond. So what we have been doing is working with those institutions to say, first, plan for surge. Plan for all the different activities that are going to be required, potentially if we got to a point of having additional needs. But we also recognize, and this is not a local phenomenon, this is a national phenomenon, that we simply do not have enough capacity if we were to see a large surge, again, if we were to see a large surge that happens all at one time, not over time, but all at one time. So it's absolutely critical for us to really work with those hospitals, healthcare entities, ICU beds, hospital beds in general, alternate care site strategies, how are they protecting their healthcare workers, personal protective equipment, how do they assure the supply chain, all the different communications messages to their own teams, but also beyond, and really testing and all the other activities that really go along with it. We recognize the incredible strength of our healthcare partners, and we're certainly working with them. And Dr. Peirce, I know, has some additional information.
Thank you, Dr. Shaw. And I want to point out, this is a great question. It really kind of goes to the crux of what I worry about. And so we have been working closely with the health systems. Bill McKeon from the Texas Medical Center has had several meetings. The mayor has actually basically chaired one of those meetings with us. And we've been talking with all the big hospital systems and some of the independent hospitals that are large hospitals. We have been talking about surge capacity for patients who require hospitalization. We've been talking about surge capacity for the emergency department, and we've been talking about surge capacity for laboratory testing. And so I want to remind everyone that this is Houston. And unfortunately, we have weather events that stress our community, not the least of which is the healthcare community. And I would remind you of 2001 with Tropical Storm Allison. We lost 5 hospitals within 3 hours on a Friday night. I, for one, will never forget that. 4 of those hospitals were 4 of the largest in the city, and they were offline for months before they came back online. And we were able to figure it out and surge at that point. Now, Tropical Storm Allison, we had no warning, and we were able to do it. So now we have a warning. We've been coordinating with the health systems, with the hospitals. Plans are in place. And, hopefully we won't have to go there. Again, I would direct you to our chart over on the side. As Dr. Shaw pointed out, our whole goal with all of these strategies is to slow down the spread of the virus throughout the community, hopefully minimize how many people become infected. But even if we are unfortunately able to fail at that, if we can spread it over a longer period of time, then the healthcare community will be able to take care of those patients. There will be an ICU bed available for the person who needs it. There will be a regular hospital bed available for the person who needs it. There will be testing available for the people who need to be tested. And one last thing I'd say before I step away from the podium is with testing, we are increasing our ability to test. We're working with the hospitals, we're working with the commercial industry laboratory testing industry, and that capacity is growing. But an important thing for people to understand is if you are not having symptoms, you do not need to be tested. And this is important to understand. When you get infected with a virus, the virus comes into your body and it starts replicating itself. And the amount of virus starts to slowly grow until the point where you start having symptoms. And then depending on, all these factors, how healthy you are, your underlying medical problems, your age, so on and so forth, determines really about how sick you will get. But if you're feeling well, even if you have the virus in you, if you're feeling well and we test you, that test is likely going to come back negative. So all that we've done at that point is wasted a test. So the testing for people who are without symptoms but are simply scared, and I understand that people can be very scared, but if you're not having symptoms, the test does you no good. It may, if you were to get tested, and we're advocating that people who are without symptoms do not get tested, but if you did get tested and it came back and it was negative, that may not be accurate. You may have tested 2 days early. If 2-3 days later you start having fever and difficulty breathing and get tested, then it would come back positive. But getting tested before you have symptoms should not give you any reassurance. So people should not ask for that. Pay attention to your symptoms. When you get symptoms, contact your healthcare provider. And here's another important part. If you have symptoms and you think that you're infected, please call ahead, because our healthcare workers are a vital asset in our community. And we've already seen at some of our hospitals how some of our healthcare workers became exposed to cases, and then they had to quarantine. Well, we can't afford to be losing doctors and nurses to quarantine when had somebody called ahead and say, hey, I'm coming in, this is what I think I have. They then properly met you at the door and escorted you in and took care of you, and the healthcare workers didn't get exposed, and they could have kept at work. So every time somebody just shows up and thinks I have it, when it turns out that they did, those healthcare workers are exposed, and then they got to go home from work, and that we can't afford that. So please work with us. Again, we've been through this before. When the community does their part and government does its part, we've gotten through this before. We'll get through it again. Thank you.
And lastly, let me just say collaboratively on that note, the city and the healthcare community, we've been working together.
And the county.
I'm sorry.
We're all in these meetings together.
But the point that I wanted to make is that what is important for our healthcare community is PPEs, personal protection equipment. And that's what we're needing. That's what we're needing from the CDC, is personal protection equipment, PPEs. And over this weekend, for example, when the call came in to me from the medical center about when we're getting ready to stand up, for example, alternative testing sites, the need for PPEs. The city's been planning for 6 situations, as well as the county, over years, and we did an inventory of our own equipment that we have. And on Saturday at 3 p.m., we sent over to the medical center 10,000 N95 masks to the medical center. So we're all working collaboratively. The county is inventorying its assets and sharing assets as well. And so all the different units are working together. Let me thank you for being here, Dr. Sharp, representatives from the county, Joel, thank you. Doctor, thank you, from the Houston Livestock Show and Rodeo, all the city council members, department heads, and we're going to keep working, and this too.
Okay, you have just been listening to the news conference by city and county officials. They're the mayor, the county judge, as well as the health officials, all talking, of course, about the coronavirus and the things that are going to be taking place the rest of this month, which essentially, and just to wrap it up quickly here, all events, large events, have been canceled throughout the city and the county for the rest of the month. That, of course, includes the Houston Livestock Show and Rodeo. Tour to Houston. All large gatherings have been canceled throughout the rest of the month. In fact, something to point out from the Houston Livestock Show and Rodeo, all of these kids you see here who do this for scholarships, the good thing is here, as heartbreaking as this is, it is the right thing to do. This is what Joel Cowley said. But we will fulfill the annual contribution to scholarships.
That's good news.
That's good news.
That's good news.
That's terrific, yeah.
And we want to double back and make sure everybody understands why they came to this decision. That decision, they said, was very hard to make, but they made the decision because of the potential for a community spread. We're talking about the Montgomery County case involving a man in his 40s, presumed case here, presumptive positive case. In fact, we have our own Steve Campion. We talked to Steve Campion at 11, at the top of the 11 o'clock show. He was there at the press conference at the time. Steve Campion, at the top of the 11 o'clock show, was at a press conference in Montgomery County. And Steve, do we have you right now?
You do, Samika. You know what was interesting at that press conference? We kept asking those questions about that man in his 40s. Where had he gone? Where had he been? Authorities in Montgomery County would not tell us. And we asked them that question several times. Is this the first case of community spread? Should people be concerned? And they really kind of pivoted on that, saying, listen, we're waiting for the CDC to come back with a positive test result before we move forward. So really in the past 2 hours, it's been remarkable from being up there in Montgomery County to being down here on the ground at RodeoHouston, because obviously the disappointment here is huge. But about Montgomery County, what I can tell you about Montgomery County is that is a man in his 40s. He started showing symptoms of the coronavirus. He felt ill, so he went to the area hospital up there. That's when doctors decided to test him. They sent that test to a lab in Houston. That came back as a presumptive positive. So that test result then goes to the CDC in Atlanta and they confirm. So we're about within the 48 hours of them getting the test result there in Atlanta before they can confirm it to the officials here in Montgomery County. But you've seen a very rapid response since that presumptive case came back yesterday in Montgomery County. We were told it happened just before 5 o'clock, 4:30 yesterday. They got that test result back, and that kind of set everything in motion. You're looking live here on the ground outside NRG Stadium because people are leaving RodeoHouston because everybody's got to be out of here by 4 o'clock. But we're joined by just some awesome people out here, some awesome Houstonians. And I want to kind of bring you into this conversation because you didn't seem concerned about this going into it. How are you feeling now?
I have the same thoughts. You know, I feel like that. I don't know. It's really. I feel like they've blown it out of proportion, pretty much. I mean, I guess with this virus, they're kind of making everybody, kind of scared. And I understand the seriousness of it, but at the same time, if you just basically if you take care of yourself and your immune system and vitamins, then I feel like you're good.
So tell me your name and who do we got here?
My name is Lestelle Banks, and this is a friend from church, goddaughter. This is my sister-in-law, Shan, and my niece and nephew.
So this was a spring break outing?
Yes, it was.
What are you feeling like right now? Because we've heard health officials in the past hour at the highest levels of government here in Harris County say, listen, we're doing this to potentially save lives. They obviously are kind of sounding the alarm, but here on the ground, people just seem to be disappointed. No one seems to really kind of have that same sense of urgency. Is that your take about it?
I feel like it's the same thing with the anthrax and the SARS and all these other viruses that have, come through or whatever. I do know that there were a few people that were affected by those different viruses, but at the same time, I feel like if you take care of your body, your immune system with cod liver oil, with vitamin A, vitamin D, all of these.
I was just going to say, what's the disappointment, though, like out here, the fact that you got to leave? I mean, you got here how many minutes or so ago?
No, we were here actually around, I want to say 10. So this is my whole rodeo experience right here. I come every year, and I come for the turkey leg, so I got my turkey leg, and so I'm happy. I actually wasn't going to get on any rides anyway, so,
We'll take that for the win. At least you got the turkey leg. But we were talking a little bit earlier about the coronavirus. Obviously, you're tasked with safeguarding your children and your family. So how are you feeling right now? Because what's the real life perspective here?
Well, we work in the school system. I actually work in the school system, and my take on it is a serious case, but my take is it's always good to err on the side of caution. So if this was as serious as the city of Houston thought it was, they should have canceled the rodeo in advance of spring break. Those are my thoughts on it.
So you would have liked to know at 8 a.m. this morning, hey, listen, the rodeo's not happening.
Let's plan something else for the kids. But the experience has been good. I mean, they have all the hand washing stations and the sanitizer, so I mean, it was a good experience.
The rodeo will close the grounds today at 4 p.m. Please remain calm and exit in an orderly fashion.
And Art and Sam, you hear them making those announcements right now. Talk to me though, just how Houston is the rodeo, and the fact that this is ending right now. It almost seems surreal to be standing here and hearing them say that.
Absolutely, and the thing is, we're on spring break now. HISD is on spring break next week. I mean, what are the kids going to do? This is what they look forward to.
What were you hoping to do at the rodeo? What were you hoping to do?
What did you want to do at the rodeo, Aubrey?
I would want to I like to ride.
You wanted the rides, right? What were you hoping to do?
Oh, so honestly, I agree with her when she said that if they weren't gonna let the rodeo continue, they should have never started it because I got dragged here, and
You got reluctantly dragged to the spring break outing. One last thought before I send it back to them in the studio. Will this change your behavior going forward? We were talking a little bit earlier about, going to the grocery store, going to H-E-B, going to Walmart. Just weigh in, from a mom's perspective, is this changing anything?
It doesn't, because the things that we've always done, we will continue. The hand washing, just the good hygiene habits is what we'll continue to do. I'm taking them to Chuck E. Cheese tomorrow. To me, Chuck E. Cheese is more dangerous than the rodeo, but we're still going to go. It's spring break.
Well, we wish you guys have a fantastic spring break, even if that means staying inside and playing Scrabble, but it sounds like you guys are going to Chuck E. Cheese anyways. Thank you for spending some time with us this afternoon. I'm sorry that it's ending a little bit short.
We appreciate it. We got a couple hours in.
Safe travels home. Such a pleasure meeting you.
You too.
So as you hear it, there's a lot of disappointment, and people are really split on whether or not this is overreaction or precaution. I know we've heard from the health officials there at City Hall saying, listen, we're doing this to save people, to safeguard them. But for the average Joe here at the rodeo who's just trying to enjoy spring break, that's a hard sell, Samika and Art. But any questions about that Montgomery County case? But because it was really striking having been up there and asking, hey, is this community spread, and not getting an answer from them, and then coming down here and listening to the officials at City Hall go, hey, this guy was at the barbecue cook-off, and that's the reason why, we're kind of concerned.
That's right. That's that's sort of the epicenter of why this whole thing decided to explode, and everything's been canceled. And you can see right now, everyone kind of hauling things away and moving things out. Thank you. We appreciate it, Steve. We're going to go ahead and wrap this coverage up, but we appreciate your all your reporting out of there. But you can see everyone's sadly leaving because it's heartbreaking. This is a huge deal in Houston, but that cart's been driving around making the announcement, everyone out by 4 o'clock.
Right, and we're covering it on every side. So of course it is sad, and it's heartbreaking to hear from these students who we're expecting to show today and through the next 11 or 12 days or so. But then you hear from the city of Houston, you hear from the city health department, the head of the health department saying that we are trying to save lives. That's his quote, trying to save lives, real lives here. So of course we're covering it on all ends. We have so much on ABC13.com as well as our news app right now, including information on the community spread, the potential for community spread there in Montgomery County.
All right, thanks for joining us this afternoon. We'll be back on digital. If you'd like to get more information, we're going to continue all of this coverage on digital, the massive impact that the coronavirus is having right here in the Houston area. Watch it ABC13.com as well on our news apps. You can find everything there. But for now, we're going to go ahead and get back to regular programming, and we'll be back on digital momentarily, ABC13.com, if you'd like to continue coverage.
This has been an ABC 13 Eyewitness News Update. For more information, head to ABC13.com or open our ABC 13 News app.
Okay, good afternoon, everyone. Breaking news. We're continuing to bring you this coverage regarding the coronavirus and the shutting down, really, of all city, all county-wide activities throughout this area for the next several weeks. That is all for the month of March. Everything shut down, according to the city and county leaders. Now, all of this started because of the virus that was community translated or transferred. That virus transferred and contracted by some individual in Montgomery County. He attended the rodeo the 28th of February, and the barbecue cook-off. That case, now in Montgomery County, was determined to be community spread. In other words, he did not travel for this. So out of an abundance of caution, they are now calling off all activities throughout the county and throughout the city. The Houston Livestock Show and Rodeo, which is a massive undertaking throughout here in the Houston area, and brings in practically 80,000 people a day for the next few weeks, that will now be shut down, people clearing out. If we can go to live pictures, if we have any of that, I'm not sure whether we have any of that, but there we have some pictures of the Houston Livestock Show and Rodeo. All of these kids, by the way, they have been preparing for a year to be showing off their calves, to showing off their steers, showing off their other animals. This is how they make money. This is how they gain scholarships as well. But the beautiful thing about all of this is that Joe Crowley did say this about the Houston Livestock Show and Rodeo. As heartbreaking as this is, it is the right thing to do, closing everything down, because out of an abundance of caution, if this begins to spread throughout the community and people begin to show up here at the rodeo when there are 80,000 people in the stadium and, you know, attending the carnival as well as the other shows, then you have a real potential of it spreading dramatically. But he does say that, quote, we will fulfill our annual commitment to scholarships. So all the kids who are going to be wanting scholarships and desiring them and have applied for them through this process of elimination, they will be able to get their scholarships. And that's certainly a great thing. So that's wonderful as we continue to look at the Houston Livestock Show and Rodeo. These, I believe, were pictures from earlier. But here they're showing off their sheep, and they're going to be showing off their steers as well a little bit later. All of that's going to eventually close down. They'll be finished at 4 o'clock. Are you all mic'd up, Alona?
I'm all mic'd up. I'm
okay,
here joining
great.
you on our digital coverage, continuing to cover this huge story in the city of Houston. This is the first time in 80 years. Obviously, we're talking about a Houston institution, and this is such an important part of our community. It's such an important part of our spring, but our health is even more important. So as you're taking a look at this, I believe that they had said they were going to wrap up all the livestock shows.
Right.
They were going to let everybody kind of finish up because
there's several shows that are right.
second.
You don't want to rush everyone out the doors, but they did stop taking people on some of the rides as well, and they were that cart, as we saw from Steve Champion's live shot, was kind of making the motions around the area, saying it will all close down at 4 o'clock.
Okay, so as you can imagine, the fans out there not happy about this. This is really blowing up social media because this has been the largest cancellation so far that we have seen here in Houston. Let's head over to Bree Berry, who's watching all this reaction come in, and certainly plenty of disappointment to be had out there, Bree.
Yeah, of course, we are hearing from so many of you on social media, you know, Twitter, Facebook, Instagram. I've had people asking so many questions, but also just expressing, you know, how they're feeling about that. And I'd say it's pretty mixed. So first, I want to pull up, we've been monitoring Rodeo Houston here because they are giving some of these updates on social media. This was what went out a while ago. It's talking about, in the interest of public health, the city and Houston Health Department have ordered the Houston Livestock Show and Rodeo to close. So we know that's already happened. But as Alona and Art just mentioned, that's going to take place at 4 p.m. So you will still notice there is a lot happening at the rodeo right now. They're still finishing up a lot. We know that they have shut down the rides. They did that several hours ago, but that's still a lot of action happening in that area right now because, as Alona said, they're not shutting it down immediately. It's going to take a little bit of time, but 1:45 now, so not too much longer. You know, we have this comment here I saw by Cora, and it says, first they canceled South by Southwest, now Rodeo Houston. So apparently the coronavirus is dangerous enough to cancel everything, fun, but not dangerous enough to cancel work. And I know that's a lot of comments on there, and while it can be a little funny, we did listen to Mayor Sylvester Turner, who talked about he expects everyone to still go to work and still show up. So, you know, seeing a lot of these different comments, a lot of people concerned, some people saying, you know what, this is something that needed to happen. So, of course, we encourage you to tweet us, #RodeoHouston. We're getting a lot of your questions answered that way. And really quick, before I go, I just want to say a big question I'm getting on Twitter, on social media, is that they want to know about refund process. If you are going to see Kane Brown tonight, you're upset about that, there is a refund process still in the works. They'll be communicated once it's finalized. I know we have a link for you on ABC13.com where you can get some of that information. So again, we'll continue to update you online, but continue to tweet us and ask us those questions that you have. Alona, Art?
Okay, very good. Thank you, Bree. Appreciate that analysis of the social media take. A lot of reaction from all social media fronts.
Yes. Now, for the folks who went down to the rodeo today, they do have until 4 p.m. We're guessing that some people are trying to get in as much time as they can, even if those rides aren't going. Erica Simon is down there on rodeo grounds talking to people, seeing how the reaction is going. Erica?
we've been out here a couple of hours, guys, and people were hearing the news as we were walking around. They were coming up to us asking us questions. Is it true? Is the rodeo indeed shutting down? And once they realized that this wasn't just a rumor, we got mixed reactions. Some folks said, great, you know, they're happy that officials are doing this out of an abundance of caution. Other people, as Bree said, wanted to know what in the world's going to happen with the hard-earned money that they spent. Are they going to get a refund? What's next? Here's a dad that we just spoke to a second ago off camera. We're going to bring him in now. Tall, he's here with his son to talk about his reaction to this 4 o'clock shutdown and for the rodeo being shut down for days to come. What do you think about that in light of all of the COVID-19 concerns?
I'm actually happy it's happening, and I'm happy I was able to be off today to come for my son's birthday today. So it just happened to be a perfect time, but I'm happy that they're doing something in relation to it. But there's just a lot of unknowns going on today in the world, so I'm happy they're taking action.
So for you, better safe than sorry?
Always, yes. Always better safe than sorry.
What did you notice today in terms of hand washing and sanitation? It's obviously a lot more of those type things out here.
I haven't seen too much anything different. I've seen those stations, and I'm assuming that all those hand sanitizer stations and hand washing stations are all standard. I don't see anything that looks different or out of place.
Do you have any tickets that you bought for the future, maybe a concert or a future day to come?
So I haven't bought any concert tickets, but I did buy an admission ticket, and today it seems like the admission tickets were, basically it was free, so it somehow we entered free without paying. So I still have the admission ticket to go, and then some more carnival tickets we're trying to get advantage of before they close us down.
Okay, got it. Thank you, Charles. Appreciate that.
Thank you.
Well, as you heard, guys, from that particular dad there, he is planning on taking advantage of the rest of the day. He was able to come in here. I guess nobody was arguing with him or fighting about whether or not he had a ticket because it's going to shut down anyway. But as you see with these stations here, and as we've been reporting for the past week or so, there are areas in which you can get hand sanitizer. We've seen especially the little ones coming to wash their hands with soap and water. Again, people have had mixed reaction. We spoke to someone who has shown livestock in the past. She says that's what she's worried about. She's concerned about people who spend day and night in the barns raising their livestock and couldn't wait to get here this year to show off of their hopefully grand prizes. And so we'll have to see what happens with that. We know the scholarships will be honored, but it's certainly a disappointment for those who have been waiting all year for this, who have come from around the state so that they can show off their animals. So guys, that's just kind of where we are right now at this particular area of the rodeo. We still see quite a few crowds and young people as you're looking right now. A lot of school groups are here. A lot of young people have come during the school day, spring break for a lot of folks. So we know that they'll be disappointed, but we've got a couple of hours to get in the fun before this thing officially is canceled for the year.
All right, very good. Thank you. Appreciate that, Erica, and speaking with others as well. I mean, that's as we've been speaking with folks at the rodeo all morning long, the sentiment has been the same. Most of them seem to be really bothered and troubled that it's closed, but as well having some understanding as to why.
Yes, and you know, we just actually got an email into the newsroom giving us a little bit more of perspective in all of this and talking about why a community would take a step like this.
Right.
The World Health Organization has been assessing this outbreak around the clock, and they are deeply concerned by the spread and severity of all of this. They are now officially characterizing COVID-19 as a pandemic. So you've been hearing about the fact that there were these 3 different elements that were necessary to declare a pandemic. And that third element that we were missing, because we did have the deaths and we have spread, but one of them was community spread, that they were really sort of waiting to see how much it would spread in the community. They said at this point, this is that final step of saying that they are recognizing it. They don't declare pandemics, they recognize pandemics. And so we have now reached what they consider to be the threshold. Again, not because of the severity. The severity has not changed, but the spread has.
And that's important to understand, because the World Health Organization does nothing different as a result of a pandemic being declared.
Right.
It essentially, and weeks ago they talked about this becoming a pandemic. And a pandemic simply means that it has spread throughout many countries, and it's on all continents, inhabitable continents, and it is. And now it has that final element of being a community spread disease, not just by travel. So all of the organizations, the health organizations, are simply acting in the same way that they were acting before, and that is trying to do all they can to test and to curb and to I guess, decentralize everyone's mass, reunions that they're having.
Exactly, and that's what they said. They said, here's the reason that they're bringing all of this up.
Yeah.
There is still time to make a lot of progress with this. There's still time for many communities and many countries to prevent this. There are 81 countries in the world that have not reported any cases whatsoever. 57 countries have reported 10 cases or fewer. So they cannot say this loudly enough or clearly enough. All countries can still change the course of this pandemic. So this is exactly what they're talking about. They're talking about canceling some of these large community events where if there is one person out there who may have been infected, they are then at risk of giving it to 100 people. This is what they were asking. And so that's the kind of a response that the city is giving to them. And this is why we're doing it, not because there are so many new cases in Houston or that anything really has dramatically changed here.
We're trying to reduce the number here, and that's what in some places in Asia, in fact, as we continue to look at live pictures out of the rodeo, and they're clearing out over there, and they're going to be doing that over the next couple of hours. But in some countries in Asia, including China, that number has already peaked. It's stabilized and, in fact, is dropping in some areas. And so we're talking about the number of people infected. So that's certainly a good thing, but they've had very restrictive measures there. Extremely restrictive. And so, but sometimes that is needed so you can curb the ongoing spread of this, and especially at a rodeo like this, when you're dealing with a man who was there on the 28th of February at the barbecue cook-off along with 75,000 other people, and then comes home and begins to spread it with whomever else. You don't know what we're going to grow into.
Yes, and so yes, they're just making that call. And again, when we look at the aerial shots, it really does tell the story of just how many people are there. This is the biggest party in our city all year. That's why we are so disappointed when it's canceled. But boy, you can understand that this is one of those types of situations where we have so many people in close contact. Not a lot. I mean, I know they added the hand washing stations. I know that they encourage everybody to keep their hands clean and use hand sanitizer. But in a situation like that, it's really difficult to completely be in control of it. So.
Yeah, it really is. You simply can't control it in large crowds like this. And because you're talking about the rodeo, which has a seating capacity of 75,000 in the NRG. Then you have the carnival, which has another, 10,000 people out there. Then you have the massive exhibition hall, which has hundreds and hundreds of vendors and thousands of people in there. It's my wife and I's favorite place to just kind of go and look and shop and that sort of thing. I think everyone else loves it as well. But that's why it's shut down.
Okay, let's get back out there to the rodeo grounds. Our own Steve Campion is there talking to some of the folks and seeing how the crowds are dispersing or not dispersing as the afternoon goes on. Steve?
Alona, it seems surreal. It's sunny out, it's warm, it's really nice, and for people just to be leaving the Rodeo Houston, it just seems kind of weird, right? Like as a reporter, as a journalist, anytime we're covering these kind of events, it always seems to be weather related. Why people are leaving, the idea that it's just a nice, beautiful day and people are leaving NRG Park and NRG Stadium, it just seems kind of surreal is the only way I can see it. You're looking live here at the people who are leaving in the past 10, 15, 20 minutes or so. We've had people going around in carts. They've been on the speakers saying that the rodeo is closing at 4 o'clock and essentially to get your plan and get on out of here. So a lot of sad faces, a lot of families that were here for spring break. We've spoken with a lot of people who really every year this is just part of their family tradition, right? Coming out to the rodeo, enjoying the time with the kids, dressing them up in those cowboy hats and boots and having a little fun. So it's sad. There's no other way to say that. We're here with Daisy. Hi, Daisy.
Hi.
She's one of the workers here who you're leaving early.
Yes, I have to leave early.
So tell me your kind of take on all of this, right? Like you were here cooking, helping people enjoy their day. What are you feeling like right now, the idea that everyone's bouncing out?
It's just kind of sad because, I've been coming here since 30 years of my life, come on. And it's just sad to see that something so big is special for Houston to be canceled for something like this. It's tragic and we need to be careful and everything, but I guess it's best for the people,
Did you have any reservations? Because obviously you're out here often, I imagine. Did you have any reservations before this cancellation of being around big crowds, being out here among the people? Did you have any personal concerns?
No.
No.
No. I think that I believe like it's gonna happen. It's gonna happen whether I'm at home or whether I'm wherever. It's just gonna happen.
With the news today, the step that's been taken, unprecedented really in the history of this rodeo, does that impact your concerns now? You went from no earlier. Are you at a yes now, or are you still no?
I'm still like at a maybe.
You're at a maybe. Okay.
At a maybe. Or maybe, you know, if it shut down the whole rodeo, then maybe yes. You know, you kind of have that, maybe I do need to go home and, you know, lock up myself in there to be safe.
Well, we certainly wish you good health. Thank you for stopping and talking with us. We're going to take people inside here to the food tent where people are at. So nice seeing you. Yeah, so a lot of people, Alona and Art, they're just like, man, this is actually happening. It's kind of surreal is the only word I can kind of use to describe out here. And you're hearing the speaker over there. Hi, ladies. Hi, Steve here with Channel 13. Can I pause you just for a second? Tell me your reaction right now. I mean, obviously, I imagine we had a fun-filled day planned.
We did.
So what are you feeling like? Are you on the team that this is an overreaction, or are you on the team like better safe than sorry?
I mean, I'm kind of in the mixed feelings. I think it's kind of an overreaction, but at the same time, like, I want to protect my kids, so we're going to do what everybody says we should do.
Did you have any concerns about coronavirus going into coming out here today, and do you have any more concerns now, or are you still kind of just waiting for more information to trickle on out?
I don't, you know, I'm just kind of waiting for it to kind of blow over. I think that it's something that everybody's unfamiliar with, which is why everybody's kind of waiting for everybody to see what the next person's going to do, to see what the next venue's going to do, to see what the next event's going to do. I do think that it will blow over. I don't think that it will be as big as it's supposed to be, or as big as people are envisioning it. But at the same time, like, we're going to do what we need to do to protect ourselves.
Last question, because I know you gotta get on out of here. But how long have you been in Houston, and how many rodeos have you been to before? That said, like, what does it feel like just to be told to get out of here?
Well, we've been in Houston for about 6 years. This is probably I say 6 years. We've lived here for 6 years, but we probably attended 10 rodeos, and you know, this is probably our third rodeo with our kids, and so we're just. You know, it doesn't feel any different to get out, because we were probably going to be out by 4 anyway today with the kids.
Nap time.
Yeah,
the nap time
absolutely.
would have taken effect by
absolutely. But at the same time, like, you know, I mean, it is different. It is a different feel, because, you know, you have the people coming around with the mega horns saying, you know, we're closing at 4. Don't panic. Just exit calmly and that kind of thing. And so that does kind of present a different feeling for us.
Well, thank you for letting me stop you, because I know you're in a rush. What a pleasure to meet you.
All right.
Wish you safe travels, good health. We know we can need it. I'm going to come over here because I made eye contact. We made eye contact. Hey, so Steve with ABC13. We're up on ABC13.com. I like how we're not supposed to be hugging. Didn't you hear the news?
We're not. So we didn't shake hands though, so I think we're okay.
I love everyone has a good like sense of humor about this. So tell me your names.
Joan Evans.
Joan.
Joni's talking to Guzman.
Okay, that's a mouthful.
Yeah, so I thought hyphening was a good time, you know.
So tell me your reaction right now. I mean, health officials, the mayor, the county judge, they're saying, listen, we are taking this unprecedented decision to close Rodeo Houston for health concerns about the coronavirus. How do you feel about that?
Well, honestly, I'm most upset because I don't get to see Lizzo on Friday.
You and me both.
Yeah, I mean, really, come on. I mean, I already had the outfit, the purse, everything picked out. I mean, I can see people are scared, but
it's the young kids that have worked so hard on this livestock, and they've worked all year for this show, and then just for it to all disappear.
And the vendor, the apple pie guy, they came all the way from Minnesota, and they're packing up to go all the way back.
We understand. It's just heartbreaking for the people that have put so much hard work into this. Especially, I feel so badly for the kids that have show their steers, show their pigs. I mean, they wait all year for this, and all of a sudden, it's just gone. It's very sad. But I understand, but you still can't help but feel badly for them.
Yeah.
Who do we got back here? And were we on spring break? Like, what were we doing out here? What were you hoping to do out here?
I was just really excited to go to Lizzo, because that was supposed to be a surprise.
and now I can't really go.
No, you can't go. There's no not really
Ryan,
going.
and that's Riley.
That's Riley.
And were you able to ride any rides? Like, how you feeling?
No, she's not a big ride rider, but
Never.
she likes seeing the bees and the chicks, and
Yeah.
But we
Well-
steered clear of the petting zoo this year.
I can't tell you what it is. A pleasure to meet you. I'm glad everybody's doing
love you.
healthy and we're feeling good.
And be careful of the stampede that's coming.
Kidding, we're kidding.
I know, I mean, for real, come on, you know.
So,
exit orderly.
pleasure meeting you.
Okay,
So
take care.
that's just some of the flavor, some of what we're hearing, Art and Alona, from the people out here. Obviously, people are kind of taking it with a sense of humor, right? Biggest disappointment you just heard, the fact that Lizzo won't be playing on Friday, the Houston hometown favorite. But a lot of people kind of understanding the decision. I think it's going to take some time for that really to set in with the people here who have so much invested, right? Whether they've spent their hard-earned money to come out here and pay for tickets for their kids, or whether or not they've spent months, getting their animal ready to be out here. So I think it's going to take some time for that decision to really set in and for people to kind of understand it or criticize it. Obviously, it's a controversial one, but we'll send it back to you. Reporting live from Rodeo Houston, which is set to close at 4 o'clock today. Steve Campion, 13 Eyewitness News.
All right, last corn dogs of the season going right now. Maybe you could bring us one, Steve. No more hugging out there either. We got to talk to Steve about this.
Listen. Sometimes you got to roll the dice.
Yeah, Steve, okay. But you know what? You can't leave that place without a funnel cake. I mean, just bring one back, yeah.
Okay, so, Steve was talking about the concert tickets. We did also just get an email from SeatGeek, StubHub, the rodeo themselves, everyone making it clear. You don't have to fight to get your money back. You will either immediately be rebooked if they are actually rescheduling the show, or you will have your options to be refunded automatically. You don't need to reach out to customer service. But we have all of this explained on our website, so that's the place to go. If you've been wondering what to do with the tickets that you already have, go to ABC13.com. It is right there on our front page. We're going to walk you through the whole process.
And of course, we're continuing to follow this impact it's going to be having the coronavirus throughout the city and the county, and as well throughout the world and the country as well. But keep it right here, ABC13.com. We'll have much more digital coverage a little bit later on. We're going to close this digital coverage and remind you to come back at 3 o'clock for Eyewitness News at 3 o'clock. For now, I'm Art Rascone.
I'm Alona Carson. We'll see you then.